The subcommittee will come to order. Just a brief announcement on the process today. We're going to go through all of the bills before we break. As a courtesy to the members from New York, we're going to recess so they can attend the funeral in New York, and then we will reconvene at 1:30. We will roll all the votes until this afternoon's session. The chair recognizes himself for an opening statement. Today we are marking up 5 bills. H.R. 1213, a bill to repeal mandatory funding provided to states in the Patient Protection Affordable Care Act to establish American health benefit exchanges. H.R. 1214, a bill to repeal mandatory funding for school-based health center construction. H.R. 1215, a bill to amend Title V of the Social Security Act to convert funding for personal responsibility education programs from direct appropriations to an authorization of appropriations. H.R. 1216, a bill to amend the Public Health Service Act to convert funding for graduate medical education in qualified teaching health centers from direct appropriations to an authorization of appropriations. And H.R. 1217, a bill to repeal the Prevention and Public Health Fund. My bill, H.R. 1217, repeals Section 4002 of PPACA. This section establishes a Prevention and Public Health Fund to provide for expanded and sustained national investment in prevention and public health programs to improve health and help restrain the rate of growth in private and public sector healthcare costs, end quote. In the current fiscal environment, we need to ask ourselves several key questions. First, should the federal government be involved in health promotion and prevention activities? One could argue yes, but the more important or relevant question is whether the amount of money going to the Prevention and Public Health Fund is proper and responsible. And should the stream of funding for these activities be mandatory and self-appropriating or discretionary and subject to congressional oversight each year? Section 4002 authorizes the appropriation of and appropriates to the fund from the Treasury the following amounts: $500 million for FY 2010, $750 million for FY 2011, $1 billion for FY 2012, $1.25 billion for FY 2013, $1.5 billion for fiscal year 2014, and for fiscal year 2015, and every fiscal year thereafter, $2 billion. Additionally, the Secretary has the full authority to use this account to fund any programs or activities under the Public Service Act that she chooses without congressional oversight. The universe of potential uses of this funding is as vast as the bill is vague in setting out how the money should be spent. Already, HHS has sent money out the door, quote, to support prevention activities and develop the nation's public health infrastructure, and to expand the primary care workforce, and for various prevention activities such as preventing tobacco use, obesity, heart disease, stroke, and other diseases, and increasing immunizations. I think all of these uses sound worthwhile. However, all of them, smoking cessation, heart disease prevention, increasing immunizations, are already being supported through other funding streams. The Prevention and Public Health Fund is funding over and above the amount Congress has specifically decided should go towards these activities, and over and above the amount Congress has already appropriated for these activities. And it is dispersed at the sole discretion of one individual, the Secretary of Health and Human Services. When Secretary Sebelius was here in front of our subcommittee, I asked her whether she needed further congressional approval to spend the money from the fund, and she answered no. I then asked her if she could fund activities at levels higher than what Congress appropriated, and she stated yes. Congress has the power to direct how federal funds may be spent. It is our responsibility to see that they are spent properly. It is our job to conduct oversight over the executive branch. Section 4002 is simply an abdication of congressional responsibility and a slush fund from which the Secretary can spend without our input, oversight, or approval. This should be a concern to every member of Congress. Let's remember, by eliminating this fund, we are not cutting any specific program or activity. We are reclaiming our oversight role of how federal tax dollars should be used. And I have 20 seconds left. Dr. Burgess? Okay. All right. At this time, I now recognize my friend from New Jersey, Mr. Pallone, for his opening statement.
Thank you, Mr. Chairman, and thank you for working with us in terms of having the votes at the end of after the hearing to accommodate our New York members who are going to the service for Congresswoman Geraldine Ferraro. This month marks the one-year anniversary of the Affordable Care Act, landmark legislation that transforms the healthcare system in this country from a system that favors health insurance companies to a system that puts healthcare choices back in the hands of Americans. With its passage, we're providing small businesses with access to affordable health plans and will cover 32 million Americans who are currently uninsured. We also help to foster the importance of preventative health throughout this country in order to curb growing health care costs. But you know this already. I've said this and debated this a million times over the last few months. Unfortunately, these hearings and markups serve little purpose because the other side has failed to put forth any comprehensive proposal to expand coverage, protect Americans from insurance industry abuses, or curtail skyrocketing health care costs. Instead, this committee calls hearings to criticize and disparage the Obama administration's implementation of the Affordable Care Act's reforms and marks up absurd funding bills on 5 critical provisions that help make the law function. The Republicans, in my opinion, are hypocritical with their seeming concern about the use of mandatory funding for some of the programs in health care reform. This markup isn't about funding streams. It's simply an effort to dismantle the health care reform law without offering any solutions in return. The truth is that key provisions under the jurisdiction of the Energy and Commerce Committee are and continue to be funded through mandatory spending authority. In fact, many are Republican-supported programs, such as the abstinence-only program, which I think is ineffective. But even so, the Republicans cry foul because we happen to utilize the same tool they've used over and over again in the Affordable Care Act. And so I think this criticism of mandatory spending authority is simply not credible, Mr. Chairman. Many states have already benefited from the Affordable Care Act. I encourage my colleagues to visit the healthcare.gov website, which contains state-by-state fact sheets about some of the important funding that is going to local organizations that many of us support. New Jersey, my home state, has already benefited from the more than $15 million in critical funding from the Prevention and the Public Health Fund. Mr. Chairman, I could talk forever about why I think that spending funding on prevention and the public health is so crucial. I know you mentioned that there might be some question about that, but I don't think there really should be. I mean, the bottom line is that, I know the CBO oftentimes will not score it, and I've been critical of them as well for not scoring it. But the fact is that prevention makes a difference. If you have a chance to go to a primary care doctor and we spend money on that, then you don't end up in the emergency room or you don't end up in the nursing home. And I know that, the CBO won't score that, but the fact of the matter is that I believe that to the extent that under the Affordable Care Act that we're providing primary care, we're providing prevention, there's a huge amount of money that will be saved. It may not be counted for purposes before the House, but in the long run, it is going to save the government and the system a huge amount of money. As you can see, I welcome the opportunity to talk about health care reform, but I really think the American public has made it clear that what we really should be doing is creating jobs and making the economy grow again. And I think we should be focusing on job creation instead of rehashing health care reform over and over again in this subcommittee. I urge a no vote on these misguided bills today, and I would yield the balance of my time to the gentleman from Texas, Mr. Gonzalez.
And I thank the ranking member. And Mr. Chairman, of course, I oppose all 5 bills that we consider today, and for good reason. But I want to address my remarks to 1213, which defunds, of course, the monies to be used to set up the state exchanges. Now, these exchanges are built upon the free markets that already exist, but they bring uniformity and adequacy of coverage at an affordable price for employers and individuals. Now, I understand that the majority party is going to continue doing this, so this is just another chapter, another phase of what I refer to as repeal and return. That is, repeal, but then return to a time that was rather perplexing and required action by the 111th Congress, which we took. A time when 10,000 Americans were losing their health insurance coverage on a daily basis. To make a situation even worse than existed in 2009 and 2010, if you look at the record, in 1963, 61% of small businesses provided insurance for their employees. In 2009, only 38%, and it's a decreasing number. What we are attempting to do today is to return to that time, which I said is perplexing, but a painful chapter in the inadequacies of health care insurance to American families and employers that want to provide it to their employees. And with that, I yield back.
Chair, thanks to the gentleman. The chair reminds members that pursuant to committee rules, all members' opening statements will be made part of the record. Are there further opening statements? Chair recognizes the chairman of the committee, Mr. Upton, for 5 minutes.
Thank you, Mr. Chairman. On March 9th, this subcommittee examined several provisions of the health reform law that were funded with advanced appropriations rather than authorizations that are subject to further appropriations. In layman's terms, that means the money is going to be spent without further congressional approval. One of the provisions provides that the Secretary an unlimited tap on the Treasury to fund state exchange grants, the scope of which seems to be limitless. No one has taken credit for writing this particular provision. I don't know of a single member of Congress who believes it is necessarily a good idea to give the Secretary of HHS a direct tap on the Treasury with no limit on how much could be spent and virtually unlimited discretion to determine what it means to facilitate enrollment in an exchange. That seems to be a reoccurring theme with the whole law. No one wants to take credit or accept the blame for what was actually written. I would like the authors of this bill to tell us why the authority was granted. Unfortunately, we don't know who in Senator Reid's office was responsible for the drafting. No member of the committee can legitimately claim the mantle of fiscal responsibility if they support such an unprecedented spending authority. If a member does take credit, I look forward to them telling this committee why they didn't put an actual number in the statute or what they actually believe the provision will cost. But the truth is, no one here wrote the section of the law at issue today. In fact, none of the provisions we'll mark up today were actually in the House-passed health care bill. In reviewing the Public Health Division of the House health care bill, there was not a single advanced appropriation for any provision. In 2009, when House Democrats wrote their bill, they didn't see the need to circumvent the congressional appropriations process. Yet some act now as if the sky is falling because we concur with their conclusion that Congress should make these spending determinations. We are facing a $14.5 trillion debt with another $14 trillion on the horizon under the President's budget. If we're going to get our spending under control, we've got to set limits, we have to eliminate slush funds, and we must prioritize our spending decisions. These 5 bills are an important way to begin. I yield back the balance of my time.
Will the chairman yield to me?
Yeah, I will reclaim my time and yield the balance of my time to Dr. Burgess.
Thank you, Mr. Chairman. You know, there are things that are worthy spending that should be on autopilot, but really they need to be the exception and not the rule. And we are an authorizing committee. That is our heritage. We vet issues, we exercise oversight, and we fight for our priorities before the appropriators. Now look, just because you think there ought to be oversight of a program doesn't mean that you're against the program. You just want to do it the correct way. The main issue here is not whether these programs deserve funding, but do they deserve priority? over the nation's defense, over the nation's veterans, over education or homeland security. In February alone, our deficit reached $223 billion. That number does not yet include the government subsidies that help pay for most of the Patient Protection and Affordable Care Act. We are on track for anywhere between a $1.5 to $1.6 trillion deficit this year. Mandatory spending in PPACA. It's become the issue du jour. Several of us has talked about this for several months. But let's be honest, the chairman was right. We're not fighting for priorities that were in the House-passed bill as much as I fought against H.R. 3200. This is a Senate product. And the nature of the Senate in designating some of these programs worthy of advanced appropriations, who asked them? They didn't ask us. This funding needs to be examined. I thank the chairman for doing so, and to the extent possible, I think we need to reclaim some of this funding. So I've introduced one of these bills, H.R. 1214, to repeal Section 4101A of the Patient Protection Affordable Care Act. Look, we hear it over and over again from the American people. They demand that we be wise stewards of the taxpayer dollars. And we can't do that if we just simply allow this open raid with post-dated checks on the American Treasury. There are programs here that I do support. I think the ideas are worthy. But I don't think that they should be valued above everything else in the federal budget. That's not right. That's not responsible. That's not what this committee does. I yield back the balance of my time.
Chair, thanks, gentlemen. Recognizes the ranking member of the committee, Mr. Waxman, for 5 minutes.
Thank you, Mr. Chairman. Today we're considering 5 pieces of legislation that would roll back important advances under the Affordable Care Act for health coverage, public health, and the health workforce. Let's begin with the new and innovative Prevention and Public Health Fund. For as long as I can remember, there has been strong bipartisan agreement on this committee that we need to do more to support health promotion and disease prevention activities that can save lives and save dollars. Our Republican colleagues in particular have advocated for state and local efforts along these lines. For the first time, we now have in law a program that is designed to do all of this. It's targeted exclusively on prevention. It's guaranteed to be funded, and its primary funding recipients are community-based organizations. And apparently, it has hit home across the public. It has hit home across the public health spectrum. Nearly 600 national, state, and local groups have written to us in support of the Prevention Fund in the Affordable Care Act. Yet today, Republicans will vote out a bill to kill the fund. That is inexcusable and goes against the often passionate arguments Republicans have made in support of health promotion programs. We should not eliminate the fund. If anything, we should put more resources into it so we can build a healthier nation and reduce our annual health care spending bill. Republicans have said time and time again that we haven't done enough to expand the health workforce, particularly the number of primary care providers, to meet the growing demands for services. So it comes as a great disappointment that another one of the Republican bills we will consider today cuts support for a workforce program that would enlarge the pool of primary care providers around the country. Still another would eliminate support for school-based health centers that offer this type of care. And just when we think we're on the same page, seems like we can't win no matter what we do. Republicans have insisted on, indeed they have been adamant about mandatory spending support for abstinence only until married education, ignoring study after study that shows this approach does not work. The Affordable Care Act contains a proposal that would fund teen pregnancy programs, including required abstinence-only education, as long as there is evidence that they are effective. But today our Republican colleagues will vote to eliminate mandatory funding for the evidence-based teen pregnancy program and leave intact the mandatory funding in the Affordable Care Act for the abstinence-only program that has been completely discredited. This simply cannot be explained or justified. Finally, we will take up a bill that attacks one of the linchpins of health reform, grants to states to establish their insurance exchanges. These grants are structured to allow states to develop a uniquely state-specific solution and design for their individual and small business marketplace. Once in place, these exchanges will serve as a building block to strike at the heart of insurance company abuses. Millions of people have suffered at the hands of insurance companies, a commonality that brings individuals together in their desire to be free of ever-increasing premiums, from denials for valid claims, from denials for having a pre-existing condition, and from rescissions of insurance when someone gets sick. I'm not surprised, but I am surely saddened that even the Republican mantra of state-based reform doesn't stop them from turning around with an ideological bill and ideological vote. Republican claims on all of these programs have been thoroughly debunked by outside observers. They've been awarded so many Pinocchios from the independent fact-checkers, it almost makes me wonder if they are trying to collect them. But what they are doing is not fiction, nor is it funny. The truth is that the bills we are marking up today represent the Republicans' newest line of attack to disrupt, dismantle, and ultimately destroy current law, which expands health care coverage to over 32 million people, closes the Medicare drug donut hole, provides free preventive care under Medicare, and strengthens the Medicare Trust Fund, prohibits predatory and abusive behavior by insurance companies, addresses public health challenges such as obesity, diabetes, and heart disease that are literally killing us and bankrupting our healthcare system, and reduces the deficit by over $210 billion in the next decade while achieving these goals. I ask, maybe futilely, but I think I ask that all members give thoughtful consideration to the substance of what we are voting on today. Common sense and sound health policy tells us we should defeat each of these bills outright. Thank you, Mr. Chairman.
Chair, thanks to the ranking member, and recognizes gentleman from Georgia, Dr. Gingrey, for 1 minute.
Mr. Chairman, thank you. I want to associate myself with the chairman of the overall committee, Mr. Upton, and the vice chair, Dr. Burgess, and disassociate myself with the remarks of the ranking member. In regard to an issue like preventative care, I think it's important for people to understand that while preventive care hopefully will save lives, and maybe for that individual, if they're the ones whose early cancer is detected, saves that individual and their family money. But in the overall picture, the big scheme of things, preventive care does not save money. It costs money, and therefore that's why we're so concerned about this endless stream of spending where you can never turn the spigot off. As everyone knows, the financial health of this nation is in a very precarious state, and I thank the chairman for holding this markup today. I think it's hugely important. Some in this room may argue, as I say, the potential health benefits some of these funding streams may provide. My concern is how much damage to our national budget the White House can do with these funding streams. Buried in 2,400 pages of Obamacare is a direct pipeline to the Treasury that allows the White House to tap into an unlimited amount of federal funding and sidestep congressional oversight. We can't allow that to happen, and that's what we're all about here today.
Chair, thanks, gentlemen, and recognizes the ranking member emeritus, Mr. Dingell, for 3 minutes.
Mr. Chairman, you are most courteous, and I thank you. Before us today are 5 bills that strike at the heart of the public health programs in the Affordable Health Care Act. The Affordable Health Care Act had many goals: to expand coverage in a way that was paid for, to improve the quality of care individuals are receiving, and to promote prevention and evidence-based care. The majority calls into the question the Prevention and Public Health Fund, the teaching health centers, the personal responsibility education programs, the school-based health center construction grants, and the American Health Benefit Exchange under the guise of being outraged at their mandatory nature. Curiously enough, many of these were ideas of the Republicans in earlier Congress. Yet there have been many numerous pieces of legislation that have come before the members of this committee that have included both mandatory and discretionary streams of funding. This is not a debate about what is new or unique in the Affordable Care Act. What this markup truly represents is yet another opportunity for the majority to strike out and repeal individual provisions of the Affordable Care Act after failing to suggest substantive reforms to our health care system. and we do await them presenting some kind of reform of their own. At its heart, defunding is not legislating. As I said yesterday, it's similar to taking an eraser to an answer on a test and then leaving it blank because you don't have a better solution. Our public health system deserves strong investment in order to best promote wellness amongst American families, as well as to continue to offer accessible health care in our communities, and to see to it that we do so at reasonable cost. Further, American families are tired of insider infighting. They want to know how and when they'll benefit from changes in our public health care system now, with which they are thoroughly dissatisfied. The Affordable Health Care Act includes some of the strongest consumer protections in our health systems ever. Insurance companies can no longer make health decisions for family. Cancer patients can no longer be denied health insurance because of a pre-existing condition. Seniors now have help in affording their prescriptions. College students are allowed to stay on their parents' health insurance plan. This is legislation at its best, offering real solutions to problems that our families in America face today. We all want health care coverage that is more affordable and covers the uninsured and the insured. Rather than spend our time in the committee showboating, let's get together, work together to improve the situations of American families across the country. I yield back 13 seconds.
Chair, thanks, gentlemen. Are there any other members on the Republican side? The chair recognizes Mr. Latta for 1 minute.
I thank the chairman. Last week I held courthouse conferences in 10 of my 16 counties. During that time, I had over 150 or 130 individual one-on-one meetings with my constituents, and the message that I got was loud and clear, was to repeal Obamacare and get our debt and deficit under control. I believe the bills before us today will help Congress rein in this out-of-control spending at a time when the deficit will reach an all-time high of $1.6 trillion, 10.9% of the GDP, and spending in fiscal year 2011 will reach an all-time high of $3.8 trillion. It is extremely irresponsible to allow the spending in Obamacare to continue. We are on an unsustainable path, and this law must be repealed. With that, Mr. Chairman, I thank you, and I yield back.
Chair, thanks, gentlemen, and recognize the gentlelady from California, Ms. Capps, for 1 minute.
Thank you, Mr. Chairman. Today we'll hear a lot of claims, like, I support this program, but it is too expensive. It's mandatory spending. It didn't follow the right process. But the truth is that the only reason these programs are on the chopping block today is that they were included in the Affordable Care Act, the health care law that is helping so many across the country, all while creating jobs and reducing our deficit. My colleagues on the other side of the aisle would rather relitigate the law day after day instead of facing the difficult work we have to do, which is to strengthen the economy and create jobs. In fact, they are so fixated with this issue that some of these bills will actually cut jobs, both in the construction industry and in the healthcare workforce. So I urge my colleagues on both sides of the aisle, let's move on. Support these programs that we know are necessary. They are working. They are improving our nation's health. And I yield back 8 seconds of my time.
Chair, thanks, the gentlelady. Are there other Republican members wishing to make an opening statement? The chair recognizes Ms. Baldwin for 1 minute.
Thank you, Mr. Chairman. Here we are at yet another markup considering bills that are out of touch with the priorities of the American people. The 5 bills put forth by the majority will not create jobs. These bills will not stimulate our struggling economy, and these bills will not put the middle class back to work. The Republican majority is playing a dangerous game of bait and switch with the American people. Despite campaign promises from the new majority that this Congress would focus on creating jobs and bolstering the economy, the bills they have offered us today fail to deliver on that promise. In fact, not only do the majority's legislative proposals do nothing to create jobs or bolster the economy, these proposals could actually exacerbate our current problems by taking away new job opportunities. Mr. Chairman, the American people deserve better. We should be focusing on what our country needs right now, jobs, jobs, jobs. Thank you. I yield back.
Chair, thanks, the gentlelady. Are there other members wishing to make opening statements? Chair sees none. Chair calls up H.R. 1217 and asks the clerk to report.
H.R. 1217.
Without objection, the first reading of the bill is dispensed with. So ordered. The chair recognizes himself for 5 minutes. None of the provisions we will mark up today were actually in the House-passed health care bill. In reviewing the Public Health Division of the House health care bill, there was not a single advanced appropriations for any provision. So in 2009, when House Democrats wrote their bill, they didn't see the need to circumvent the congressional appropriations process. But now, some are acting as if the sky is falling when Republicans seek to return to annual appropriations and regular authorizations. Take, for example, the Public Health and Prevention Fund. Some members have decried attempts to eliminate the fund, claiming it is designed to fund this certain activity or that particular program. The truth is that we can't guarantee that the money in the fund will go to any specific activity or program. When asked directly if she could spend the money without further congressional approval, Secretary Sebelius said yes. She is not obligated to spend it in ways that members of Congress think are best. The fact of the matter is no member can tell this committee how this money will be spent in the year 2013 or 2016 or 2057. Congress gave up that ability when my colleagues on the other side of the aisle provided the Secretary with a slush fund to spend on whatever she deems worthy. As I stated earlier, my bill, H.R. 1217, would repeal Section 4002 of PPACA, the section which establishes the Prevention and Public Health Fund, over which the Secretary has complete discretion. I urge my colleagues to support the bill. Are there any amendments or further discussion of the bill? Chair recognizes the ranking member, Mr. Pallone.
Thank you, Mr. Chairman. I strongly oppose this bill to repeal the Prevention and Public Health Fund. And I don't know how many times I, again, will keep saying how important prevention is. Just as an example, I mentioned in my opening remarks about the impact of the Prevention and Public Health Fund in New Jersey and the website where you can go in New Jersey and see how some of this has been spent. And I just want to mention one. I mean, there's so many things, but primary care training, state health care workforce development, $150,000, helps New Jersey strengthen its comprehensive health care workforce planning. Primary care residency expansion program, $10 million, increases the number of residents trained in family medicine, general internal medicine, and general pediatrics. Advanced nursing education expansion program, $808,000, increases the number of primary care nurse practitioners and nurse midwives who graduate by expanding class size. Clearly, as we move, and we already have, towards providing primary care for people right now that don't have it because they don't have health insurance, we're going to need nurse practitioners, nurse midwives, doctors in the primary care area. And, I mean, that's just one aspect of prevention, but I use it as an example because if a person can go and see a doctor on a regular basis, either in a doctor's office or in a clinic, and we have the primary care people to do this work, all these health professionals, then it's going to be possible to save all kinds of money because people are not going to get sick and end up in a nursing home or in the emergency room of a hospital. And I just use that one example, but it's such a good example of how we are saving money. So, this suggestion that somehow this is a slush fund, this isn't necessary, as far as the Secretary is concerned, contrary to what our Republicans are suggesting, the mandatory spending nature of the fund does not disempower the appropriators if Congress does its job in a timely fashion. Under Section 4002D of the bill, the House and Senate Appropriations Committees have the explicit authority to allocate the fund at their discretion through the appropriations process. In fact, the Senate and the House Appropriators attempted to do that under the fiscal year 2011 omnibus bill, but that legislation, was not enacted. And it's only under circumstances like that, when Congress fails to pass a labor appropriations bill, does the Secretary have the authority to allocate the prevention fund. And the reason for that is because, as we know, many times in the last, decade or more, with both Dems and Republicans in charge of the House, we have not acted on the appropriations bill in a timely fashion. And frankly, this prevention fund is too important to just let it pass and it not be used. I use the doctors as an example, and the training of primary care physicians, but I could use so many other examples. This is really the heart of what we're trying to accomplish when we talk about prevention and dealing with public health. So to suggest, I mean, I could give examples in your own state, Mr. Chairman, or Representative Murphy's, both of you represent Pennsylvania. Over $22.5 million in grants have been dispersed through the Prevention and Public Health Fund in Pennsylvania, including over $1.9 million in community and clinical prevention, $2.5 million in public health infrastructure, over $18 million in workforce development. That goes back to that primary care training again. This is important, and we should not make light of it or suggest in any way that this fund should be repealed. And unless someone else wants my time, I'd yield back, Mr.
Chair, thanks, gentlemen, and recognize the gentleman from Kentucky, Mr. Whitfield, for 5 minutes.
Thank you, Mr. Chairman. I, for one, am delighted that we have the opportunity to revisit Obamacare. We certainly didn't have an opportunity to even know what was in that legislation last year. I remember when the bill went to the floor, no one was able to offer even one amendment to the bill, recognizing that what we're talking about today came out of the Senate. We certainly did not know what was in that bill. And I still, for one, speaking for my constituents, am very much upset even today on the process of that bill, written by the White House, by the Speaker, no amendments being offered by anyone on the floor is unimaginable to me when you talk about a bill that big with that impact on our society. Our friends on the other side of the aisle, whom we all admire and respect, constantly talk about, oh, our bill is going to teach the health insurance companies a lesson. We're not going to let them do everything they want to do. And I would remind everyone that the health insurance industry was right out there in the front to pass Obamacare. They wanted the bill. So if they wanted the bill, I do not understand how our friends on the other side of the aisle are saying that the Obamacare bill is going to get them under control. They wanted the bill, they worked for the bill, and they did everything they could do to pass it. This particular legislation, 1217, that we're working on right now, I might say that this, the community putting prevention to work provision of the bill, which I would emphasize once again, appropriates $17.5 billion over the next 10 years for the fund in advance, as well as $2 billion in perpetuity each year forever, is in the bill. And before the Obamacare was passed, under the American Recovery and Reinvestment Act of 2009, $650 million was dedicated to establish this program that was then funded with another $17.5 billion and $2 billion per year in perpetuity. And even the Washington Post had an article about the origination of this communities putting prevention to work. They had an article that showed that in the District of Columbia, out of those funds, $1 million was spent purchasing BlackBerries for people in the District of Columbia to call their healthcare providers if they felt an urge to smoke a cigarette, for example. And then when Rebecca Bunnell, who's the CPP program director, in December of 2010, just a few months ago, went to South Carolina, and she was talking about the successes of this program. And she said, for example, in July 2010, the city of Baldwin Park, California, passed a 9-month moratorium on any new fast food restaurant in the city. So we're talking about jobs. Our friends on the other side of the aisle talk about jobs. We should be talking about jobs. Their program, Community Putting Prevention to Work Act, killed jobs in Baldwin Park, California. You cannot build one fast food restaurant in that because of these taxpayer dollars. So I, for one, am delighted that we're going to try to pass this legislation stop the funding of this. It is, as I said in the beginning, it's our first opportunity to really to revisit some of the provisions of this bill and have an in-depth understanding of what's in this bill. And with that, I yield back my time. Thank you.
Chair, thanks, gentlemen. Any other members seek recognition? For what purposes does the gentlelady seek recognition? Gentlelady is recognized for 5 minutes.
Thank you, Mr. Chairman. I speak in opposition to H.R. 1217, a bill that would defund a strategic investment in our nation's long-term fiscal and physical health, the Prevention and Public Health Fund. Simply put, this fund is the critical piece to making our nation healthier and, in turn, to bringing down health care costs. This misguided bill would defund the program, returning us back to a system based on sick care, a system that isn't working, we know that, rather than one focused on health and wellness. And that's something, frankly, we really can't afford to do. Just a few weeks ago, this subcommittee heard from the governors of Michigan and Mississippi about the tough financial times they are facing in their states and how Medicaid spending is impacting their budgets. One of the key drivers in these costs is chronic disease, which is what makes this bill so short-sighted. The programs funded by this bill help defray the growth of both public and private health care costs by preventing and postponing chronic diseases that drive so much of our entitlement spending, all the while improving the lives of patients. States and counties all over the country are realizing this. In my home state of California, we are putting these funds to work by investing in programs to promote tobacco control, implement tobacco cessation services and campaigns, build up our state and local capacity to prevent, to detect, to respond to infectious disease outbreaks, take steps to slow the alarming rise in obesity rates. We are also using it to support and train our current and next generation of public health professionals, to build our next generation of the healthcare workforce, and it is working. That's why local governments and national organizations alike oppose this bill. I think it's an impressive list opposing this bill, including the National Association of Counties, the National Association of City and County Health Officials, as well as the Association of Maternal and Child Health Programs and the American Public Health Association and the Trust for America's Health, just to name a few. These are all adamantly opposed to this dangerous bill at a time when we have a clear epidemic in our country of obesity and diabetes, at a time when we are seeing a resurgence of preventable diseases like whooping cough, and when counties have laid off thousands of staff and struggled to maintain essential public health services through the current economic downturn. The need for this kind of legislation becomes so much more critical. So as I yield either to a colleague or back to the chair, I ask unanimous consent to insert a letter from the National Association of Counties in strong opposition to this bill. And I'll yield the remainder of my time to the chairman of the ranking member of the subcommittee.
The gentlelady will provide us with a copy of that.
Of course.
Mr. Pallone.
I just, I have said several times in the last 2 days about how CBO does not count prevention, unfortunately. But there is data out there about this, about how you can save money or have a good return on investment. First of all, there's a study by the Trust for America's Health that found that investing in the kinds of community evidence-based programs that the Prevention Fund supports could have a return on investment of $5.60 for every dollar spent. And, I guess what I just want to stress is that we, in the past, we send people to hospitals, we send them to nursing homes, they're and it's just a shame because a lot of this could be prevented. And what we really need to do is to move towards a system where a wellness system, which is exactly what the Prevention Fund and the Public Health Fund are designed to do. So I just can't stress again that we're saving money, we're making people lead productive lives. We're getting away from the idea that, we just throw people away in institutions as opposed to trying to make them healthy and productive again. It's just a shame that we're doing this today. I mean, I don't believe it's going anywhere, thankfully, because this really is the heart of the health care reform. And I would yield back to the gentlewoman.
Chair thanks the gentleman. On the UC request, without objection, the letter from the National Association of Counties will be entered into the record. And the chair recognizes the gentleman from Georgia, Dr. Gingrey, for 5 minutes.
Thank you, Mr. Chairman. Mr. Chairman, my concern with this fund is that really there's no limitation in the language creating the public health and prevention fund that would in any way prevent the Secretary from using these funds to pay, as an example, for political advertising in support of the President's bill, and of course we're talking about Obamacare. If the Secretary of Health and Human Services feels that these are ads are in support of prevention, I mean, it would be entirely at her discretion. I think back to the Andy Griffith ads of a year or so ago. Let me address a couple of questions to counsel, if I may, Mr. Chairman. Can the Secretary spend money from this fund without further congressional action?
That is correct.
The answer is yes, she can. It takes no further congressional action that she can spend unlimited from that fund. Let me ask you a second question, counsel. The ranking member of the subcommittee, Mr. Pallone, mentioned that Section 4002D provides the Appropriations Committee control over how the money is spent. Would the authority for the appropriators to direct spending in the fund require Congress to pass a law for that section to have effect?
That's correct, Mr. Gingrey. Yes.
It would, in fact, require Congress to pass a law for that section to have effect.
That's right.
Well, one last question, and I thank counsel, and then I'll yield back. Could Congress pass a law to direct funding in the fund even if Section 4002D was not included in Patient Protection and Affordable Care Act?
Subsection D does not provide additional authority to Congress beyond what it would already have absent this subsection. So the answer to your question is yes.
Well, I thank counsel, and Mr. Chairman, I'll yield back.
Chair, thanks, gentlemen. The chair recognizes, for what purposes, gentlemen, seek recognition?
I move to strike the last word.
The gentleman is recognized for 5 minutes.
Let me convey, I strongly oppose H.R. 1217. This bill strikes Section 4002 of the Affordable Care Act, the Prevention and Public Health Investment Fund. The goal of the investment fund is to improve an expanded and sustained national investment in programs that improve public health, while restraining the rate of growth in health care costs. Saving on the front end to spend more on the back end, this does not make sense to me. I firmly believe in the old adage that every ounce of prevention is worth a pound of cure. Preventive measures are one of the key ways that healthcare costs can be contained. And I agree with my colleague and from the state of New Jersey, Mr. Pallone. As a prime example, my district has a high rate of diabetes. In many cases, this disease is highly preventable through proper diet and exercise. If we invest in education now, then we can save on the high human and economic costs associated with the treatment. Prevention should be a key priority for all members who are concerned with the rising cost of health care. I urge my colleagues to oppose H.R. 1217. We should focus on prevention, and this is not the way to do it. On that note, Mr.
Gentlemen,
I yield to the ranking member of the committee.
I just, one of the ironies of all this, thank you, my colleague from New York, one of the ironies of all this is that we have mandatory funding that's been embraced by both Democrats and Republicans on, every year for Medicare, Medicaid, and other federal health care programs that pay for health care services when people get sick, to develop, after they develop an acute illness, they have an injury or a chronic disease, and they have to go to the hospital or nursing home or whatever, and that's okay. But now when we have a similar approach to promote wellness and prevent disease and protect against health emergencies, that's the wrong approach. And I don't know how I would even explain that to my constituents and say to my constituents that, it's okay to have this mandatory funding, for all these situations where you're getting sick and you have to be hospitalized, but we can't use it for prevention so that you don't have to go to the hospital or go to the nursing home. Again, it's just I think the whole mandatory funding argument is really a ruse because we use it all the time, and we certainly use it when people have to be institutionalized. But now you're on the other side saying we shouldn't use it for prevention, which, again, makes no sense to me. I yield back to my colleague from New York.
Chairman, thanks, gentlemen. Any other members seeking recognition? For what purpose is the gentleman seeking recognition?
Strike the last word in order to be
recognized for 5 minutes.
Millions of dollars are spent in mandatory funding each year via the Medicare, Medicaid, and other federal health care programs to pay for health care services once patients develop an acute illness, injury, or chronic disease and need treatment in our health care system. We don't hear any screams and yells on the other side of the aisle about that. There's been no similar approach to these mandatory spending programs that now Republicans want to impose on these efforts to promote wellness, prevent disease, and protect against health emergencies. By creating the Prevention Fund as a reliable funding stream rather than another authorized but unfunded program, because let's recognize what will happen. We authorize a lot of programs. They don't get funded. Republicans want to take all these important programs and authorize them and then put them out to fight for funds against all the other efforts where appropriations are sought. And often these are the programs that go unfunded. But by providing a reliable funding stream, we're finally putting our money where our mouth is on prevention. And polling has shown the American people identify prevention as their top health care priority. According to the Trust for America's Health and the Robert Wood Johnson Foundation, they found 71% of Americans favored an increased investment in disease prevention. Now, you want to ignore that 71% of the American people wanting a systematic funding stream for these efforts because of some belief that the traditions of this committee require we only authorize and can only do oversight unless we authorize. That's not a good argument to me. We have oversight on Medicaid and Medicare. We don't appropriate money. We don't authorize the money. We appropriate. We don't even appropriate it. They're mandatory spending programs. So repealing this program would mean putting the brakes on investments that are already beginning to make a difference. States are already using prevention fund dollars to reduce tobacco use and obesity, prevent HIV, build epidemiology and laboratory capacity to track and respond to disease outbreaks, and train the public health workforce. States are finding themselves with an overwhelming budget crisis. Now, I've seen comments by Republican leaders to tell the states, don't look to us for help. You've got your own problems and it's your fault. Well, a lot of their problems are based on the recession. And they don't have the revenues they used to have. Many times they have still needs that have to be paid for. And as they're facing budget crises, we cannot afford to abandon these programs just as states begin this critical work. So I want to be clearly on record. I know this is going to be a party line vote, and the Republicans are in the majority in this subcommittee and presumably in the committee. And if Republicans want to vote their party line vote, even though 71% of the American people think there ought to be a funding stream for prevention. Go ahead and do it. You can prevail in subcommittee. You can prevail in full committee. It doesn't make you right. Maybe you'll even prevail in the House. In the process, you'll put a lot of people on record against what 71% of the American people favor. But if you think this is the right thing to do, go ahead and do it. I think it's being done more for politics. The gentleman from New Jersey outlined why he thinks we are experiencing these bills, because members of the Republican side of the aisle want to chip away at the health care reform bill. And as our esteemed colleague, Ms. Capps, said, don't we have better things to do? Let's get on with other things that this committee ought to be doing instead of refighting this fight over and over again to no purpose except politics. It served you well in the last election. I don't think it's going to serve you well in the next one. I think the American people want us to do something more important than fight this fight over and over again. And to start this fight by repealing prevention money just doesn't make sense to me, and I don't think it'll make sense to the American people. And I want to yield back the 5 seconds that I have.
Chair, thanks, gentlemen, and recognize the gentleman from Ohio, Mr. Latta, for 5 minutes.
Well, thank you very much, Mr. Chairman, and I'll yield to Dr. Gingrey.
Mr. Chairman, I thank the gentleman from Ohio for yielding, because I did want to respond to some of the things that have been said by the last couple of members on the other side of the aisle. It was just stated that rhetorically, don't the Republicans have anything better to do than what they're doing today? Quite honestly, if the Democratic majority had done what they should have done as number one priority 2 years ago, instead of cramming this bill, this law, PPACA, down the throats of the American people when they clearly did not want it, and it was forced through the Senate by this trick of reconciliation, whatever you want to call it. So we're here today to try to undo the mistakes, in our opinion, that was done to the American people 2 years ago. My friend from New York said an ounce of prevention is worth a pound of cure. I guess he could have said also a stitch in time saves 9 in regard to this prevention bill. But as I said in my opening statement, if you're going to take a stitch or you're going to darn every sock in the country, you're not going to save any money. A stitch in time might save 9 and a few pairs of socks, but you're not going to save any money. And the same thing in regard to an ounce of prevention is worth a pound of cure in an individual, in a small population of people. But in the whole country, you're going to spend a heck of a lot of money trying to prevent one person from getting an illness. Now, I'm a physician, so it's a very sensitive thing to talk about for a doctor who has spent his whole professional life essentially involved in patient care and in a compassionate way, I might add. But we have to think about unlimited stream of funding in these bills, in this first one that we're talking about, where there is no limit. And that's what our concerns are. This funding stream, in my opinion, represents a clear and present danger to the financial health of this nation. And we must have congressional oversight. So that is our concern here. And I hope everybody understands the position on this side of the aisle and why the chairman is bringing these bills forward and why it's so important. Mr. Chairman, I'll yield.
Would the gentleman yield to me just a minute?
I will yield to the gentleman from New Jersey.
I know that both sides of the aisle are guilty of not, completing the appropriation bills on time and all that. But, if you think about what Mr. Waxman said and what I talked about, these programs for training doctors that I mentioned, or nurses, or the studies that Mr. Waxman mentioned about diseases, we're in the middle of a situation now where we have a CR for 2 weeks, 3 weeks, who knows beyond that. I mean, when I talk to people who are talking about long-term planning to have enough primary care doctors or for disease studies, I mean, it's just not conducive to that. The way we operate, and it's getting worse and worse, and I'm not, just accusing the Republicans of it, is just not conducive to that kind of long-term prevention. I just think that the very nature of what's necessary to get doctors trained, to have primary care, to do disease prevention, it's not, if we continue with this, stopgap measures, 2-week measures, 3-week measures, 6 months measures, we're not going to be able to deal effectively with those prevention.
Reclaiming
Sure.
my time. We reclaim my time from the gentleman. Let me just say that if the Senate majority, Democratic majority on the other side, would allow us to cut a measly $100 billion from the 2011 budget that the president sent to us way back when, and we're facing a deficit in his current budget that he sent to us in the last month of what, $1.6 trillion. I mean, if we were allowed to cut that just little sliver of $100 billion, maybe we would have more money to spend on training doctors and other things we need to do. And I yield to the gentleman from Louisiana.
I actually agree with you. It would be better if we had some sort of, and I'm not sure that the dysfunction that has resulted in CRs being done on a weekly basis or 3-weekly basis should mean that we forego our responsibility to the American people to make sure that we review these programs and make sure they work. I can tell you, coming from academia, there is dead wood in academia. But once you enshrine it as an RFP from a government program, that dead wood persists. Our responsibility, I see, is to cut out that dead wood and to focus our taxpayer dollars upon those that work. So,
okay, the gentleman's time has expired. The gentleman from Louisiana gets the last word. The question now occurs on favorably reporting H.R. 1217 to the full committee. All those in favor say aye.
Mr. Chairman, I don't know when I'm supposed to ask for the yeas and nays. Okay.
All those in favor say aye. Aye. Opposed, no.
No.
The ayes appear to have it. The ayes have it. The bills and the gentleman, Mr. Pallone, requests a recorded vote. So the question of favorably reporting the bill to the full committee is postponed until this afternoon.
Mr. Chairman, can I also make a UC request with regard to certain letters?
Yes, for UC request.
I ask unanimous consent to enter the following letters in opposition to H.R. 1217, and I believe all these have been given to the majority. First is a letter organized by Trusts for America's Health, signed by nearly 600 national, state, and local organizations. Second, a letter by the Association of Public Health Laboratories. Third, by the Association of Maternal and Child Health Programs. Fourth, by the Association of State and Territorial Health Officials. Fifth, by the Prevention Institute. Ask unanimous consent to have those included.
Would you be kind enough to give us copies? We'd like to review them.
I think we have, but I mean, I'll give you these.
You're okay? Yeah. Without objection, they'll be entered into the record.
Thank you.
Thank you. The chair now calls up H.R. 1214 and asks the clerk to report.
H.R. 1214.
Without objection, the first reading of the bill is dispensed with. So ordered. Are there any amendments to the bill? Does anyone seek recognition? Mr. Burgess is recognized for 5 minutes.
Thank you, Mr. Chairman. I introduced H.R. 1214 to bring attention and to continue to advance the discussion around advanced appropriations within the Patient Protection Affordable Care Act. Currently, there are close to 2,000 school-based health centers in the United States. Section 4101A of the Patient Protection Affordable Care Act provides $50 million in mandatory spending for construction of school-based health centers every year through 2013. From 2008 to 2011, health centers received $2 billion in funds each year in discretionary funding. Under the Patient Protection Affordable Care Act, they received $11 billion in authorizations. In addition, $1.5 billion was included in the stimulus bill that could have been used for construction of school-based clinics. I'm not maintaining that there may not be a need for additional construction funds, but certainly not that there was a complete unmet need that would necessitate bypassing the appropriations process. Also, the $150 million in grants under 4101A are for construction only, and there is an express prohibition on these funds being used to provide health services. That means not one new doctor is hired, not one new nurse is hired, and that is the specific language signed by the President 1 year, 1 week, and 1 day ago. All this legislation does is to rescind the unspent funds and return them to the taxpayer. I'm more than happy to work with colleagues on both sides of the dais to see what construction needs there are for school-based clinics and to work with the appropriators in the context of our current budget situation to do what is possible. I would also point out that Section 4101B of the Patient Protection Affordable Care Act creates a new discretionary grant program for school-based health centers, but this grant program requires them to use the funding to provide health services. And interestingly, in the President's 2012 budget released earlier this month, the number of dollars requested to staff the clinics out of the discretionary fund that the President submitted was $0. So why didn't the President consider providing care at school-based clinics a priority? If providing for hiring the doctors and the nurses is not a priority, why should the Congress make building new facilities a priority? I'm not against the health centers. If anything, I think it'd be easier to develop health centers if the school-based centers were part of the discussion. I worked for years to get a federally qualified health center in Southeast Fort Worth in my district. It took years. The siting of these clinics is almost purely political. We finally got one up and running, 1 doctor, 2 exam rooms in an area where the need is significant. It shouldn't be that hard. The reality is it's hard because of the way we do it. This is one step to untying that knot. Now look, why does the VA have to come to Congress every year to expand a clinic or build a VA hospital? But school-based clinics under 4101A don't have to do that. This is a step towards financial responsibility, a step for bringing some sanity back into this process, and I urge the committee to support the bill. Now I yield back the balance of my time.
Chair, thanks. The gentleman. For what purpose does the gentleman seek recognition?
Strike the last word. Or
the gentleman is recognized for 5 minutes.
Thank you, Mr. Chairman. I have to say that if the Republicans are going to choose any program to defund in the health care reform, this is the last one that they should be choosing, in my opinion, because the school-based health centers are a true success story. They provide primary care, mental health, and dental health services to vulnerable children all across the country. And multiple studies have found that these programs are a cost-effective investment of public resources, resulting in lower emergency room usage, hospitalizations, and Medicaid costs. In fact, patients seen at school-based health centers cost Medicaid an average of $30.40 less than comparable non-school-based health center programs. So, again, it's preventative, and we should do all we can to support and promote these programs. And that's exactly what the Affordable Care Act is trying to do, to provide the resources necessary to make school-based health centers a reality. Funding goes towards construction, renovation, and equipment for these centers. And once the nuts and bolts are in place, more children can receive the services that they need. It also helps the economy. There's been a lot of discussion on both sides of the aisle today about job creation. Well, the funds are used to support construction jobs, renovation supplies, equipment such as exam tables, blood pressure monitors, dental chairs, and then these are all shovel-ready. These are things that create jobs for the communities that are just waiting to get underway, and I don't think we should put them off any longer. So again, I don't understand. Is this really where you want to be focusing your energies, on defunding or eliminating school-based health centers? I would certainly hope not. I'd urge my colleagues on the other side to offer, other ways to create jobs in our states and improve the health care in our communities. I think by repealing this initiative, they're really making a huge mistake. And I don't know if anybody else.
Will the gentleman yield to me?
Yield my. Excuse me?
Will you yield to me?
Oh, I'll yield to you. Sure. I'll yield you a minute, and then I'll give the rest to Ms. Capps.
Well, I was just going to inquire if the gentleman was going to provide us a copy of the letter he has written to the President, asking the President to fund the discretionary part of the 2012 budget to provide for the hiring of the doctors and the nurses. As you know, the President zeroed out that figure in the 2012 budget. This is a bill to rescind the construction funds. Since the President has not put a priority on staffing, I would remind the gentleman that an exam bed and a blood pressure cuff cannot provide preventive care in and of themselves.
But I would
appreciate
assume,
the courtesy for yielding. I'll yield back.
But I would assume, Dr. Burgess, that since we have this funding in this program, that's one of the reasons it's not in the budget. I mean, I'm assuming that.
The discretionary part was for hiring the doctors and the nurses. We've got mandatory funding for
I
bricks
see.
and mortar.
You're talking about the
You're
hiring
build something with an exam bed and a blood pressure cuff, and no one is there to pump the sphygmomanometer up.
All right. Well, that's a good point. But the bottom line is
I hope you'll submit your letter to the President, to the committee, so we'll be able to see that.
My only point, though, is that regardless of your point, and I understand it now, I still don't think we should be repealing this program because this program is creating jobs and is necessary. I yield the rest of the time to Ms. Katz.
In terms of the part that was zeroed out in the President's budget of maintaining the health centers, one of the qualifications for applying for funds for any school-based health center is that the entity, the school-based clinic, have sufficient funds to staff and run the center once they receive the funding for construction. But also, our colleague from the other side of the aisle keeps saying that school-based health centers have had access to recovery dollars, but that isn't really the whole truth. The only school-based health centers deemed, only the school-based health centers deemed a federally qualified health center could apply. Only 25% of such school-based health clinics are federally qualified health centers. Therefore, 75% of school-based health centers could not apply. In fact, only 3 community health centers that have school sites have received funding, and it's not clear that the funding went to the school sites specifically. The construction funding is the first federal funding specifically designed for school-based health centers, and these centers have to demonstrate that they have sufficient funds to staff the clinics once they are constructed. I thank my colleague for yielding time.
The gentleman's time has expired.
Can you go back the last 90 seconds? I would just ask who drafted the stimulus bill? Yeah, yield back.
Gentleman's time has expired. Anyone seeking recognition? Dr. Cassidy is recognized for 5 minutes.
I actually speak as an advocate for school-based clinics. I think they're effective. I've done lots of immunization work through school-based clinics. And I do see their role as somewhat different from the typical federally qualified health center. I'll also point out that we're currently borrowing, 40% of our $1.4 trillion budget? And if this comes up as a discretionary bill, I will support it. But as we in Congress have a fiduciary responsibility to our taxpayers, and as we see countries across the nation, across the world, having their bond rating downgraded, and we have Moody's saying that we will degrade ours. Now, we could say that, well, wait a second, this is just chump change in our whole budget. I would concede that. But I'd ask my colleague from New Jersey, who I have great respect for, I would love your suggestions as to what we should cut out of PPACA. If you say this should be the last, what should be our first? Because I think that we have to find savings. There's going to be advocates, including me, for different things that we are cutting. But I am so totally open to alternative suggestions.
Gentlemen, yield?
I will yield.
No, you probably will disagree with what I'm going to say, but I want to express a point of view to you. When we're giving tax cuts to the top 1% of the population, and then we go after programs that benefit the lowest income people, that doesn't make sense to me.
Now, can I reclaim my time? And
so I think we could...
Now, a couple things.
What's your time?
Reclaim my time. First, I'll point out that your party signed off on that and helped pass it. But secondly, let's not fool ourselves. Even if we had implemented the taxes on the upper income that you guys agreed to but now object to, that would not cover our deficit. That would not even come close to covering our deficit. Now, if we had rescinded,
the gentleman yield further.
If we had rescinded everything, including the taxes upon the middle class, then that would have begun to do so. But I think you're referring specifically to the upper income, and so that I think is a little bit of a, no offense, misleading the American people to think that we could fund our entire government if we just had the tax on the upper one.
Gentleman yield further. Well, I don't think we could fund our government by doing something of the tax cut area, repealing some of that, reversing some of that tax cut decision. But there is a question of priorities and justice and fairness in our evaluations of those priorities. We cannot close this deficit without increasing revenues. It's not going to happen.
Well, I agree with that. We're coming on my time. Yeah. That's why, among other reasons, I want to have a reopening of outer continental shelf drilling so we can get those royalty payments as well as the tax from the folks who actually will have jobs with benefits as opposed to...
Well, I'll ask you the question you just asked us. Will that close the deficit? Of course not. But do you really think that cutting out some of these prevention and school-based clinic programs is really where we have to go to close the deficit?
I am so open I am so personally so open to folks from your side of the aisle making suggestions as to what we would cut, not raise taxes, but cut out of PPACA or elsewhere in order to, in lieu of this. And
along those lines, do you think we ought to have some of the direct subsidies to the agricultural interests or to the oil companies, or the corporate welfare, what we call corporate welfare, where we actually spend money? I'm not even talking about the...
Reclaiming my time, I am so open to cutting out some of the subsidies that we're currently giving to solar and to wind, $24 per megawatt, I believe it is,
not oil.
Which is exponentially higher than that which is given to other forms of fossil fuel. And clearly we have a philosophical difference. But I will say, if within PPACA you have things that you think would be better to cut, because it becomes a little bit unwieldy to go outside of PPACA. But if we go into PPACA and you have things that you'd be willing to cut, I think we on this side of the aisle will be open to that discussion. I yield back.
Gentleman yields back. Any, the gentlelady, Ms. Capps, is, what purpose does the gentlelady recognize or seek recognition?
I'm not used to going ahead of my ranking member, but I do move to strike the last word.
The gentlelady is recognized for 5 minutes.
I believe it is so unfortunate that today's markup is another effort by this subcommittee to do everything it can to take away access to health care for thousands of Americans, including our children. As we learned in our hearing on the subject, many of my Republican colleagues agree that school-based health centers provide comprehensive and easily accessible preventive and primary health services to millions of students nationwide. Services that keep students healthy in school and learning. Services often the only source of health care for these children and adolescents, which is why I find it quite puzzling that my Republican colleagues are here today trying to jeopardize these very services by eliminating funds that would allow communities across the nation to benefit from access to a school-based health center. In fact, as I've mentioned before, interest in creating new school-based health centers is so great that this year alone, HHS has received 350 applications for this funding. These requests came from 46 different states, hundreds of congressional districts, including the districts of 10 of my Republican colleagues on this very subcommittee. That means that applicants in 10 of my Republican colleagues' districts have taken the time and resources to compile their applications, submit them, and are expecting to hear if their projects can move forward. I'd like to ask Council, what happens to those who have applied for this funding if we rescind the money?
Funding already obligated would not be affected. Funding that has not been obligated would be rescinded under the...
Okay, I would turn to Mr. Burgess, the author of this bill. As someone who is on record as supporting school-based health centers and the author of this bill to strip money for these centers, can you tell me what would happen to the applications that are currently under review that have come from your congressional district and to those communities waiting a decision on their application?
I'd be happy to bring them back under the discretionary process, but I would remind the gentlelady that it does no good to build a gleaming new clinic with a new exam bed and a new blood pressure cuff if you have no doctor and no nurse in the clinic.
Ms. Capps controls the time.
Thank you. The answer to my question, as the Council has indicated, is those who have applications in the pipeline will receive no money. My point is that 350 applicants are now ready to expand school-based health centers, have demonstrated that they have the funds to operate them, but your bill will prevent all of them from doing so. These centers can't wait for my Republican colleagues who have promised to repeal, and maybe one day we'll get around to thinking about replacing them with discretionary funding. Their students need access to care now. Kids don't wait. They need help now. They need access to the care that school-based health centers provide, and they need it now. At a minimum, 200 centers across the United States would be funded under the Affordable Care Act, but this provision is gutted by this bill. And these centers would not only be increasing access to health care for students, but they'd be creating jobs. Just to be clear, this funding means jobs for hardworking Americans on at least 200 construction sites. During these tough economic times, these are exactly the kind of shovel-ready projects that we should be funding, not eliminating. School-based health centers construction is a great economic stimulus and would provide incredibly important new services. It's a win for American workers. It's a win for American children. Instead, if this bill passes, none of them will get the funding and no new jobs can be created. Now some of my colleagues question why we are solely providing money for construction and not for operations of the centers. I'd be more than happy to support additional funds for centers for operation of these cost-effective school-based health centers so that the hard-pressed school districts can receive adequate resources and the communities that are affected by them. Since it's not an option today, I want to point out that the grant application guidelines specifically require that applications demonstrate how they will support operating costs, as well as provide an operational budget to provide these services. To me, cutting this particular funding source that has wide-based bipartisan support across the country, nonpartisan support, I should say, just because it is so critically demonstrated and so proven effective on school-based campuses that if you have access to the children for health care services, the health care of the entire family increases. There's a ripple effect. These are some of the most cost-effective programs that we have in public health today. They have been demonstrated to be effective. It's not a large amount of money, and yet this is the program that you have chosen to gut in the cutting of mandated service.
Gentlelady's time has expired. The gentleman from Kentucky, Mr. Guthrie, is recognized for 5 minutes.
Thank you, Mr. Chairman. I'll yield to the gentleman from Texas, Mr. Burgess.
Just to briefly point out, February of 2009, the American Recovery and Reinvestment Act was passed. $1.5 billion was present in that for the clinics. If there was a drafting problem, when your side drafted that legislation and you failed to fund the clinics, don't come back and try to say that this is now the correct way to do it. You had plenty of time to do it. You had plenty of chance to do it. There were drafting errors in ERA. There were drafting errors in PPACA. You can't fix everything with mandatory spending. I yield back.
I yield back.
Gentlemen seek recognition. The gentleman's recognized for 5 minutes.
And I thank you. Mr. Chairman, more in sorrow than anger, I note that this is a part of the efforts of my Republican colleagues to repeal in whole or in part, or to delay the progress towards putting in place a program of national health insurance protection for the people of the United States. This particular part of the program is not going to construct any 12-story health care centers at schools. It's simply going to see to it that a facility is available where applications are made and where funds are available on schools to provide health care for kids, school-based health centers. It's a good program. I would note that you have applications for them. Mr. Burgess has applications for them in your districts, Mr. Whitfield, Mr. Shimkus, Mr. Rogers of Michigan, Ms. Rogers of Washington, Mr. Lance, Mr. Cassidy, my good friend Mr. Barton, and our chairman, Mr. Upton. You all got those applications in your district, and these are from responsible people. Now, what is the purpose of one of these things? Kids now go to consolidated schools, very large entities that cover very large areas. Both parents work. The kid may be 10, 20 miles from home, and the parents are at work. They don't know whether that child who might have diabetes or might have some kind of incipient illness is going to be safe. On top of that, These are places where you catch and the dangers of these things, and where we find that preventive medicine can have its best impact because it's getting kids in the early days of their life rather than late. And it's a part of what we saw in the prior bill. Here we're seeking to address the problem of prevention. Now, I'd remind my colleagues that the bill that passed the Congress, the health reform bill, is paid for. We're not adding to the deficit. First 10 years, it puts $140 billion into reducing the deficit. The next 10 years, $1.4 trillion. These are extraordinary numbers. This is a fiscally responsible thing, but it is also a health responsible thing because it does something that is important. You're getting prevention. You're getting kids who are going to get health care education. A child coming from a family of limited means where both parents work and are perhaps limited in their education is not going to have the health care breaks that a kid coming from a more affluent family is going to have. So here we're talking about something that in fact is going to pay off. We're going to get a significant benefit to the society, a tremendous benefit to the kids. And remember, these kids are only 25% of the population. Nobody speaks for them. But they're 100% of the future of this nation. 100%. And if you're going to have them healthy and well-educated, this country in times to come will be able to compete. If we don't, those kids are not going to be able to compete. And this is not going to be a healthy nation. Remember, we are trying to reform the entire healthcare structure of this country, to move it towards prevention, to move it towards seeing to it that everybody has care, to see to it that the costs of a sick and poor society are not inflicted on coming generations. The country is going broke under the healthcare system that we have, and the costs of it are going up. This nation ranks with the third world nations in terms of the health care that we give to our people and in terms of the practical results that our people see. And so what we're trying to do is to see to it that we can break that cycle. We can get the costs down so that it's not costing us twice what it costs every other nation in the world to provide health care. And to see to it that no longer does health care go up twice as fast as it does in other nations around the world. This is a small item. It has been costed out. It is included in the cost estimates of the legislation. It is sound. It is good. It helps kids. It takes care of the future. I urge my colleagues, let's look to the future. Let's do something worthy of the future of this country. Let's protect our kids.
Gentleman's time has expired. Chair recognizes the gentleman from Georgia, Dr. Gingrich, for 5 minutes.
Mr. Chairman, thank you. And the gentleman from Michigan, of course, the distinguished ranking member emeritus and former chairman, is one that I have great respect and admiration for, as we all do, not just on this committee, but in the entire Congress. And I'm not trying to refute his words, but there are some things that in the remarks that the gentleman made that really concern me. I don't think, as an example, I don't think that our health care that we provide in this country is equivalent to that of a third world nation. I think it's a lot better than that. In fact, I believe that it, and not, I say this not just as a physician, but as also as a consumer and a patient, that I believe that we have, in my opinion, the best healthcare system in the world. Now, it is too expensive, and certainly I would agree with that, and the gentleman's certainly correct in regard to that. But I don't think he's correct in saying that this bill, the Patient Protection Affordable Care Act, PPACA, Obamacare, is paid for. It may be paid for if every assumption that was given to the Congressional Budget Office Director, Mr. Elmendorf, is correct. But as an example, the assumption that only 6 million people are going to end up losing their employer-provided health insurance and end up in the exchange, that's a huge assumption, and many people today feel that that number is probably going to be closer to 75 million than 6 million. And then when you think about the premium subsidy and copay subsidy, if they're below 400% of the federal poverty level, all those additional people in these exchanges, that creates this giant new entitlement system. And you take and even if it was truly paid for, that is the health care law. Now the gentleman described it, I guess, as national health insurance, and I know that there are members of this body that feel very strongly that's what we should have, national health insurance. But I don't think so, and I don't think my constituents think so, and I don't think that 62% even today, a year later, a year and a half later, think so. And again, you pay for it by robbing Peter to pay Paul, and Peter, of course, is Medicare, which has an unfunded liability of $35 trillion probably out 75 years, and you take $500 billion away from that program, and then you send out glossy ads to senior citizens saying how we've improved Medicare. I just think that that's wrong, and I just feel like these comments needed to be made. And Mr. Chairman, I yield back.
Gentlemen, yield?
I'll be glad to yield.
Why haven't you told us these feelings that you have before? You are now telling us that you don't think the Accountable Care Act was a good idea because it cuts in Medicare and people don't like it. Some people might like it, but you don't like it. Your constituents don't like it. Not. I don't recall you ever saying that before. Oh, wait a minute. You said it last time on the last bill. You said it a couple days ago. You said it 2 weeks ago. We've heard it. So why don't we move on?
Well, reclaiming my time, let me just say it one more time. I don't like it worth a tinker's darn, and I won't like it till the cows come home until we repeal it and replace it, and I yield back my time.
Chair, thanks, gentlemen. All right. The question now occurs on favorably reporting H.R. 1214 to the full committee. All those in favor say aye.
Mr. Chairman, seeking recognition.
I'm sorry. Pardon me, just a second. I'm sorry.
To strike the last word, I was seeking recognition.
Oh, I'm sorry. I didn't see you. Gentleman's recognized for 5 minutes.
Thank you very much, Mr. Chairman. Here we go again. Let me convey, I strongly oppose H.R. 1214. This bill would strike Section 4101A of the Affordable Care Act, which provides funds for the construction of school-based health centers. This section was included in the Affordable Care Act to increase access to clinical prevention services. I've long been a strong supporter of good work that those school-based health care centers are doing. I have 6 of these centers in my district, and I assure you that if every school could have one, they would open it immediately. These centers provide critical access to quality health care that many students would not receive. Many of the students who seek care at these centers are economically disadvantaged. Frankly, I believe that we should be constructing more of these centers rather than cutting their funding. And let me also add that I join in the statement made by the gentleman from Michigan. I want to associate myself with that statement because I really think that what he said was just so important today more than ever. And I'm hoping that as we move forward, that we will keep these things in mind, that we need to cut costs, yes, but just to cut stuff out and not to have something to come into its place, I really can't be supportive of that. And I raise that question all the time, what are we going to put into place? And the answer is nothing. So I can't support this.
Gentleman, yield.
I'd be delighted to yield to the gentleman from California.
do you realize that the Republicans really don't like this health care reform bill? They dislike it, and they'll tell us every opportunity they have to tell us. They'll reiterate it. They'll underscore it. They'll stand on their heads and tell us it. So what are they doing? Well, of course, they're going to repeal the school-based clinics. That'll show people that they really don't like this health care bill. But that doesn't make a lot of sense to me, and obviously it doesn't make a lot of sense to you either. And I just wanted to add that in the mix of things because we all want to continue to talk and talk and talk, and I thought, well, maybe I'll help out in talking and express my feelings about the matter. Thank you for yielding.
Mr. Towns, would you yield to me for one last word on this?
I'd be delighted to yield to the gentleman.
Well, I just find it striking that the former chairman of the full committee, when we marked up H.R. 3200, I don't recall this provision in mandatory funding in H.R. 3200. You did have an opportunity when you marked up the stimulus bill to do this funding. I don't understand why you didn't draft the stimulus bill in that way. I see I'm keeping the chairman up, so I will yield back to Mr. Towns. But there were other opportunities. This is something that was delivered to us by the Senate, and we're just supposed to accept it. I say no. If you're going to fund these clinics, fund the doctors and the nurses, not the bricks and mortar. I'll yield back.
Gentleman from California.
I know you've said that before, but we don't always have the House passed bill become law or the Senate passed bill become law. We have usually a combination. In this case, we had more of the Senate bill because of the unusual process. But it's the law. It doesn't make a difference where it started. It's in the law that was passed. Now, if you want to repeal it, I understand. So why do you want to tell us over and over again you want to repeal it because it didn't pass this committee? I don't think that's a good enough reason. Wherever this provision came from, I think it's a good provision. You don't think it's a good provision. You want to eliminate it. You have a majority, you'll eliminate it, at least in the vote in this committee. But we're expressing to you we don't think that's a good idea, and you're telling us you think it is a good idea, and we could continue saying that over and over again. And I don't think we're going to convince you, and it doesn't look like you're going to convince us. So why don't we move on?
All right, the gentleman yields back. I think we're ready for a vote. The question now occurs on favorably reporting H.R. 1214 to the full committee. All those in favor say aye. Aye. Those opposed, no.
No.
The ayes appear to have it.
Ask for a recorded vote, Mr. Chairman.
The gentleman requests a recorded vote, and the question of favorably reporting the bill to the full committee is postponed until this afternoon. The chair calls up H.R. 1213 and asks the clerk to report.
H.R. 1213.
Without objection, the first reading of the bill is dispensed with. So ordered. Are there any amendments or discussions on the bill? The chair recognizes the chairman of the committee, Mr. Upton, for 5 minutes.
Well, thank you, Mr. Chairman. I would like to think that we could pass this vote today and move it to full committee as well. A couple arguments that I'd like to make in support of the bill. One is we know that 2 federal judges have ruled PPACA as unconstitutional, and yet the states are beginning to prepare themselves for funding of the state exchanges. We don't know what the ultimate result is going to be. A number of us would like to see an expedited process at the Supreme Court, perhaps hear the arguments as early as this summer, hear a decision and see a decision come this fall. But again, this is a bill that would require an authorization versus a blank check to determine precisely how much money should be spent. And until we know whether the bill is constitutional or not, there are a number of us that believe that we ought to see what that decision is before we spend who knows how much money for all these different states. So in the interim, repealing the fund, requiring an authorization would seem to make some sense, particularly as we grapple with a $1.5 trillion deficit this year and is predicted again for a $1.6 trillion deficit next year. Let's see an authorization. Let's see if we can't put some conditions here, particularly as it relates to the validity of a Supreme Court decision later on. So that's what this bill does. It's only a page or two long. I'd like to think that we could pass it and consider it before the full committee next week.
Chair,
back.
thanks, gentlemen. For purposes, gentlemen seek recognition.
Let's strike the last word.
Gentlemen's recognized for 5 minutes.
I would just point out to the chairman, whom I respect, that it's not normally the case that because one lower court has struck down a provision that we assume that it's going to be thrown out by the Supreme Court, and therefore we just don't pay attention to the law. In fact, I think that the executive branch has an obligation to continue enforcing the law under those circumstances. But needless to say, look, the states are preparing for the exchanges. They've been awarded, 49 states and D.C., along with 4 territories, have been awarded almost $54 million in planning grants. If they don't set up these marketplaces, then they face the possibility of having to join the federal exchange, so that, and I'm sure a lot of you would not like to see that as an alternative. And these grants are not open-ended. They're not available beyond 2015. So I just wanted to ask counsel, if I could, a couple questions in that regard. Isn't it correct that starting January 1st, 2015, that state exchanges must be self-sustaining?
That is correct.
In fact, Section 1311D5 specifically states that there are, quote, no federal funds for continued operations. In establishing an exchange under this section, the state shall ensure that such exchange is self-sustaining beginning on January 1st, 2015. So, counsel, doesn't that mean that states do not have the authority to use any funding from the federal government provided to them under Section 131 for their state exchange beyond January 1st, 2015?
The Secretary may award state exchange grants to states, and they may be spent after 2015, but they cannot be awarded after January 1st, 2015.
The money can't be spent. So, I mean, my point is that the funds are time limited. Now, I know that you, on the other side, are making a big deal about mandatory spending, but I wanted to ask counsel, isn't it correct that the Medicare Modernization Act, Section 1860D31, provided for a Medicare prescription drug discount card and transitional assistance program with unlimited mandatory funding amounts?
I don't have that specific provision in front of me. I do know MMA did include mandatory funding.
All right. I mean, let me just quote from the law. There, it says, "They are authorized to be appropriated to the Secretary such sums as may be necessary to carry out the Secretary's responsibility under that section." These monies went to low-income seniors to help with prescription drug costs, but the Secretary also had total leeway to pay enrollment fees to private prescription drug discount card programs with these unlimited such sums, and had unlimited mandatory administrative funds to implement the program. The exchange grant authority is time limited, so I would contrast the exchange to the program under the Medicare Modernization Act, because the exchange grant authority is time limited and can only be used for the establishment of exchanges as specified in Section 1311. In addition, I'd like to point out that the Secretary, in coordination with the HHS Inspector General, will have authority to investigate exchanges. Exchanges will be subject to annual audits. If the Secretary finds serious misconduct, payment otherwise due to the exchange may be rescinded up to 1% of such payments until corrective actions are taken that are deemed adequate by the Secretary. In addition, this committee, the Committee on Government Oversight and Government Reform, and other congressional committees, the GAO, and others can provide oversight of the implementation of the activities and expenditures under that section. So my only point is that this is limited in time for the states. It's no different, really, than what you did under the Medicare Modernization Act. And there's also ample opportunity to investigate these exchanges, and if they're not doing what they're supposed to do, to even penalize them. But beyond that, we purposely set up state exchanges as the main vehicle to have the average American be able to get a good benefit package, to be able to choose, to have lots of choices, and also to have a subsidy with tax credits to help pay their premium. The Republican effort to repeal these exchanges obviously will essentially eliminate one of the main purposes of the Affordable Care Act, but also make it more difficult for states to set these up and force them to essentially do it on their own if they don't get the federal grants, or simply move to federal exchanges, which I assume you probably like even less than the state exchanges. So there's absolutely no reason to move this legislation. Thank you,
The gentleman's time has expired. Anyone seeking recognition? All right, the question. For what purpose does the gentleman seek recognition? Gentleman's recognized for 5 minutes.
I do want to be on record in opposition to this bill. I think Mr. Pallone did an excellent job of expressing the concerns that many of us have, but there are a lot of things that states need to do in making decisions about these exchanges. Do they want a market where all insurers are allowed to participate in the marketplace? Do they want to offer additional benefits than those offered by typical employer plans today? Do they want a wide range of options for more comprehensive plans with greater cost-sharing protections to high-deductible health plans tied to health savings accounts? If so, they can. Do they want an integrated eligibility and enrollment system for the tax credits for qualified exchange plans, Medicaid, and other programs? If so, they can. Do they want one statewide exchange or smaller exchanges throughout their state? They can choose. Do they want a separate individual and small business exchange or one exchange? And they can make that decision. But all this flexibility, all this choice, all this work that 49 states, District of Columbia, and 4 territories are engaged in would be fully undermined by a repeal of the exchange establishment grants by H.R. 1213. And if we take away their money to plan these exchanges, the truth of the matter is the federal government will run the state exchange if the state does not set one up. Now, I heard my distinguished chairman say that he's hoping the Supreme Court will throw this bill out. I know others are hoping that it'll die of death, some way or other. But laws are laws until they're no longer considered laws, either by replacement by the Congress or by a court decision. And I don't think we ought to take away the choice from the states. I know that Republicans don't like this bill. I think this part was in the House-passed bill, but that doesn't make any difference. It's the law. And even if you don't like the law, I don't think stomping on the very people we're all trying to stand up for, like the states and the kids in school-based clinics and all these other things, is an effective way to express it. So I just want to respectfully disagree. We ought not to take away this money from the states, and then we'll see what happens in the future. And I want to point out something that I thought might have been confused by a statement one of our witnesses made. There was an untruth. This wasn't a witness. There was a statement by Representative Guthrie at yesterday's hearing where he asserted that CMS Administrator Don Berwick suggested that exchange establishment grants can be used to plug deficits in state Medicaid programs because money is being used to build Medicaid information technology or IT eligibility and enrollment systems. And I want to clarify the record. The fact is that the exchange establishment grants can be used to develop information technology systems for the eligibility and enrollment of people into qualified health plans. It's also true that Medicaid funds with a 90-10 match rate can be used to develop information technology systems for the eligibility and enrollment of Medicaid-eligible persons. Now, a smart state would not create 2 silo systems. They instead would probably pool their resources and create one system that can be used to check for both and enroll a person in the appropriate program. This makes the most sense because a person does not necessarily know if he or she is a Medicaid eligible or eligible for tax credits for an exchange-qualified plan when they approach either the exchange or Medicaid. According to November 3, 2010 guidance from CMS, quote, state exchange grants will provide 100% support for the exchange IT infrastructure and 90% matching rate will be available for the exchange-related eligibility system changes as well as for those Medicaid system changes not directly related to the exchanges, end quote. And the funding announcement for establishment grants additionally says states should allocate costs associated with eligibility determination between Medicaid, CHIP, and exchanges. So if a state is building one IT system that will handle both exchange and Medicaid eligibility and enrollment. Federal exchange funds cannot be used to supplant Medicaid costs that have a federal and state share requirement. I'm not a certified fact checker, but the Republican the assertion that exchange grants are an open invitation to plug Medicaid budget holes gets a rejection from fact checkers, and I just wanted to state that for the record because I think it was an honest mistake, and I wanted to clarify it. I yield back my...
The gentleman's time has expired, Chair. Thanks, gentlemen. The Chair recognizes... For what purpose does the gentleman seek recognition? The gentleman's recognized for 5 minutes.
Thank you, Mr. Chairman. I'd like to begin with some clarification from counsel. These questions will require yes or no answer. Counsel, is it correct that only qualified health plans can be offered in the exchanges?
That is correct.
Counsel, is it correct that the Secretary must certify health plans so that they may be qualified to be offered on the exchange?
I believe that is correct, with the caveat that I believe states can also certify
counsel, is it correct under Section 1311C that a qualified health plan must, and I quote, ensure sufficient choice of providers and provide information to enrollees and other prospective enrollees on the availability of in-network and out-of-network providers?
Yes.
Now, counsel, so it is then correct that if a plan were not to make providers available in rural areas, like areas in Michigan or in the Rocky Mountain West or in Appalachia, or were not to make oncologists available, this provision would allow exchanges to keep these plans, which do not offer adequate protection to consumers, from being offered through the exchange. Is that correct? Yes or no?
I can't answer a hypothetical about the Rocky Mountain West. The Secretary will determine what adequate network standards are.
Simply put, though, the Secretary, the system would keep those kinds of plans off the exchanges, and they could not then be offered.
Again, that's a hypothetical.
Thank you. Now, the primary basic function, then, of the exchange is to provide clear and transparent information regarding health plans to consumers and to protect consumers from insurance company abuses. And the grants that we're debating today that we would defund will help ensure that the states have the resources and the knowledge they need to do things like running the exchanges, which they will be setting up as state plans. Now, my dear friends and colleagues in the majority purport to be the party that's for flexibility of the states. And I would note that the exchanges came about through the hand of that well-known left-wing liberal, my dear friend Bob Dole, in the Senate. And it is ironic that we are debating legislation that would strip away the ability of states to put together exchanges that best work for them and to see to it that they have the money and the staff to do the things that needed to be done to assure appropriate protection for the consumers. Now, the bill does a lot of things. It ends discrimination for pre-existing conditions, gender, health, status, or family history. It requires coverage of preventive health care services. It protects patients' choice of doctors. It prevents rescissions of coverage, which can be done now while you're being ridden into the operating room on the gurney. And it prohibits arbitrary limits on coverage. It requires disclosing of premium increases before they take effect and requires that a justification therefore be provided. And it also assures that reporting of the amount of premiums spent on costs outside of health care, amongst other things, take place. Now, these changes cannot be successful, and the exchanges and the basic legislation will not be successful unless the exchanges are set up by 2014. There's a time limit, but the exchanges also have to be adequate when they get to work to do the things that they're supposed to. Now, we know that demand for these exchanges, 49 states, the District of Columbia, and 4 territories are all taking steps necessary to develop a state exchange that will work for them. And what we want is that they have the ability to do the things on the exchange that's going to make these exchanges work for the people who are going to be the consumers of health care. And in that, we'll see to it that we also take care of the providers who are going to have the same knowledge and information, and we'll see to it that the states get plans that will work to address their own peculiar and special concerns and problems. So I would urge my colleagues here, let's not go along with this legislation. It's bad. It is not going to lend the necessary ability of the exchanges to do the work that they need to do, and it's not going to leave us with a situation that's going to serve the nation well. So I would urge my colleagues to vote no on the legislation, and I thank you for giving me the time. I yield back 1 second.
Chair, thanks, gentlemen. Chair, recognize Mr. Guthrie for 5 minutes.
I move to strike the requisite words. Thanks, Mr. Chairman. I just wanted to bring up the comment yesterday that was brought forward. I said in the hearing that I was quoting from Kaiser Foundation News Report, and perhaps they were inaccurate in their quote of Mr. Berwick. If they weren't inaccurate in their quote of Mr. Berwick, maybe it was taken out of context, and maybe we'd have the opportunity for him to explain, because the context, and I don't have the quote in front of me today, but the context was states were asking Mr. Berwick about relief from the Medicaid provisions and Medicaid, and the subtext of the quote was, were there other opportunities for that, and suggested the facilitation fund that the Secretary has that's the subject of this debate. So just to say that didn't happen doesn't mean it didn't happen. So maybe the ranking member said that. Maybe Mr. Burke would like to explain, and perhaps we could request him explain the context of his remarks. Thank you.
Gentlemen, to yield, I just wanted to, we can't find that Kaiser News Report. If you could submit it for the record. I haven't been able to find it.
We'll get the where that's quoted from to you. Thank you.
All right.
Okay, Chair, thanks, gentlemen. Anyone else seeking recognition? Gentlelady from California, Ms. Capps, is for what purpose?
I move to strike the last word, Mr.
Gentlelady is recognized for 5 minutes.
I'm speaking in opposition to H.R. 1213, a bill that would burden already cash-strapped states and take away a state's ability to provide access to health insurance for their citizens. The Health Exchange Implementation Program exists to assist states in planning and establishing health benefit exchanges, which are tailored to their state's specific needs. In fact, it is the exact type of program that gives states the flexibility that they've been asking for to design a program that suits their citizens. And that's exactly what some of our colleagues on the other side of the aisle have also called for. These exchanges will make it easier for consumers and small business to better shop for health insurance coverage, because they can do so based on price, benefits, and services, and as well as quality. And they will make the health insurance market more competitive and more transparent. I think we can all agree that no one health exchange is going to fit the needs of every state. And the needs of a small state might be very different from the needs of a state like my home state, California. And that is why the exchange program the funding program enables states to create their own unique approach. It allows states to make decisions about how their exchanges should be set up, what is right for them. And it's not only sensible, it ensures that in these tight financial times, states are able to implement exchanges that are going to work for their citizens. And that's why cutting this program is not only financially irresponsible, it's really ideologically misguided. Many states have already started planning their exchanges. California, for example, after extensive input from its citizens, submitted its exchange application earlier this year. Yet under this bill, states that have not already submitted an exchange proposal would be out of luck. Instead, they would have to use their state's often extremely strapped resources to propose a plan. They'd have to, in other words, they'd have to take their own state's funding. They wouldn't be eligible for the federal grants program. Or they would have to just accept the exchange program that the federal government sets up for them. And that's something that clearly many on this committee on the other side of the aisle oppose. So a vote for this bill is a vote against the fiscal and physical health of our states. A vote for this bill is wasteful, as each of our states have received at least $1 million to begin this process, something that would stop in its tracks if this program is repealed. So a vote for this bill is misguided, as it does not reduce costs. It just shifts them onto the backs of already cash-strapped states. And that's why I'm going to vote no, and I strongly urge a no vote. And at this time, I have some remaining time, and I'd like to yield it to the ranking member. Oh, so Mr. Pallone, okay. So you want your own? I'll yield back the balance of my time, Mr. Chairman.
All right. Chair, thanks, gentlelady. Anyone else seeking recognition? Dr. Gingrey, recognize for 5 minutes.
Mr. Chairman, thank you. I won't take 5 minutes, I don't think, but I did want to address a couple of questions to counsel. Counsel, in regard to the exchanges, we've had a good little bit of discussion about that, particularly in regard to this bill. Can states change the minimum benefit level that's covered in these plans that are sold in their exchange? Do they have any control over that benefit level?
They can only add to the standards promulgated by the Secretary and the provisions included in the statute.
So let me make sure I understand. The Secretary of Health and Human Services sets the standard. The individual states can plus up the benefit level, but they can't take away from it.
That is correct, Mr.
This
Gingrey.
is established by the Secretary of Health and Human Services. Can the states, that is, can they change the rules, say, governing this medical loss ratio, where a plan has to spend so much of the premium dollar on actual medical care, and they're not allowed to use the balance, the delta, administratively, and this is referred to as medical loss ratio. Do the states themselves have any control over that? Can they tell a XYZ health insurance plan that they can offer a product that only covers, let's say, as an example, 70 cents on the dollar to direct health care, and 30 cents on the dollar could go into administrative costs? Do they have any control over that?
No, the states don't have that ability.
Who does control that?
The Secretary.
The Secretary of
Health and
Human Services.
That is correct.
Currently, Ms. Sebelius.
Correct.
Secretary Sebelius. So you basically just answered my third question, and that is that it is the Secretary that does that, and not the individual states, not the governors, but the Secretary of Health and Human Services, whomever that might be. Fourthly, can the Secretary also bar any provider from contracting with any insurance company, basically driving them out of business the Secretary deems necessary for quality reasons? Let me repeat that. Can the Secretary also bar any provider from contracting with any insurance company, basically driving them, the provider, not the insurance company, driving the provider out of business if the Secretary deems necessary for quality reasons? In her opinion, the provider doesn't have the qualifications necessary. Is that correct?
Under 1311H, a qualified health plan may contract with a health care provider only if such a provider implements such mechanisms to improve health care quality as the Secretary may, by regulation, require. So you're correct, Mr. Gingrey.
Counsel, I appreciate that, and I think it's important for people to understand. This may be, in fact, in my state of Georgia or any state that Ohio, my colleague from Ohio, a physician that is licensed in the state, does not have any restriction on their privilege to practice in regard to hospital facilities or licensing, State Board of Medical Examiners, whatever. But in this bill, it sure sounds like to me within these exchanges that the Secretary can trump that. I think this is a pretty dangerous situation, and amount of power that we in this Congress never intended for the Secretary of Health and Human Services to have that kind of control over the providers of medical care. I'm not asking you a question in regard to that. That's just a statement. Mr. Chairman, I'll yield back.
Sure, thanks. Gentlemen, for what purpose does the gentlelady from Wisconsin seek recognition?
Mr. Chairman, just strike the last word.
Gentlelady is recognized for 5 minutes.
Thank you, Mr. Chairman. Once again, instead of focusing on creating jobs or bolstering our economy, we are considering several bills today that will lead to job loss and hinder our economic recovery. Today, we are considering a Republican proposal that would repeal funding for grants to states to create exchanges, healthcare exchanges. H.R. 1213, the bill before us at this moment. These exchanges are critical for ensuring that thousands of small businesses and 24 million Americans have access to new coverage options. I don't know why we chose the word exchanges, but if you think about it, the exchange is intended to be like a health insurance supermarket, to give people choices at different prices with different selections. These grants that are being repealed and rescinded in this bill are to provide states with both the means and the flexibility to create an exchange, a health insurance exchange in their state that best meets their state's needs. Wisconsin has already received $38 million through what's known as an early innovator grant. This very important funding will spur job creation up front in Wisconsin, and it will improve access to quality, low-cost health care coverage when the exchange is fully up and implemented. This bill before us raises an important question. Are we going to ask cash-strapped states like my own to return the money they've already been awarded if it hasn't been spent yet? Will Wisconsin have to return the $38 million that Governor Walker has recently accepted? I really fail to see how rescinding money that we know will create jobs up front is the right thing to do to get our economy back on track. I also just want to reflect on something that some members of this committee who have served for a while will recall, and that is when Congress debated what is now known as Medicare Part D. You know, that was a deeply partisan debate, in large part because the Republicans didn't choose to pay for it. But the structure of that program, Medicare Part D, was very similar. That it required states to set up insurance exchanges for prescription drug coverage. And I just want to note that even though this was a bitterly partisan debate those years ago, Democrats worked with the majority to make the best of it. We didn't try to rescind funding for setting up the state exchanges to make Medicare Part D a reality. We didn't try to repeal the bill. We said, despite the fact that it was a deeply partisan debate and we were deeply divided over it, that we wanted to work together to make the best of it on behalf of our constituents. And I would ask the Republican majority to do the same. We need to work together on behalf of our constituents to provide a quality, high-quality, affordable health care for those in our constituencies that haven't had that opportunity for a long, long time, if ever. I urge my colleagues to oppose this very ill-conceived measure. And I yield back the balance of my time.
Thanks, gentlelady. Anyone else seeking recognition? For what purpose does the gentleman seek recognition?
Move to strike the last word.
Gentleman's recognized for 5 minutes.
Thank you, Mr. Chairman. I want to piggyback on what Ms. Baldwin said because I think she was right on target. Healthcare is something that's very personal to the American people, and I really believe this ill-conceived attempt to try to defund or block the health care bill is really moving in the wrong direction. I think what the American people want to see us do, frankly, is they want to see the parties work together to try to come up with sensible reform, that if there are parts of the bill that the majority does not like, then we need to work to improve it, not repeal it. And it's been one measure after another to repeal the bill or to defund the bill. I mean, I don't know how many times we're going to have to do this. It's obvious that it's going nowhere. The Senate is not going to pass it. The President certainly would veto it. So this is just, making political points for my Republican friends. Now, I understand, we all play that game. We all throw red meat to the crowd. But, enough is enough already. We're wasting time doing this again and again and again, and we're really not doing what the American people sent us here to do. I really think that what the American people want us to do is put our heads together and fix the things that the majority feels are objectionable or that consensus may feel is objectionable. I have no objection to that. But to try to, defund it, I hear from my friends on the other side of the aisle, well, why don't we have a competition? Why don't we why can't you purchase insurance across state lines? So what are you doing now? You're defunding the exchanges in the states. Not to mention all the other thing with community-based, school-based health care programs, which we talked about a little while ago. I mean, I know in my district, those programs are just terrific. The high school in which I graduated, the public high school, has a program like that, and it's wonderful. It really helps the kids. It serves the kids. I mean, that's really what we should be doing. Health care is something that's near and dear to everybody's heart. And so I just think that this nonsense of, well, health care is going to cost money, we think it's going to save money. And if my friends on the other side of the aisle were so concerned about saving money, then as Ms. Baldwin points out, Medicare Part D was not paid for. I mean, blew a big hole in the deficit, blew a big hole in the budget, as are the tax cuts, the Bush tax cuts for the wealthy, as are the estate tax cut for the super rich in this country. It doesn't seem to bother my Republican friends when the budget is out of whack, as long as it suits their priorities. But I think that if you really are concerned about deficit reduction, then you need to be consistent. And so defunding, once again, we're going to do this, then next week we're going to do it in the full committee, and it's going to go nowhere. It's going to pass the House on the floor. The Senate's not even going to take it up, and if they do, it'll be defeated, and if it's not defeated, President Obama will veto it. So this is just political theater. It's a political charade, and it's really not worthy of what, frankly, we should be doing. Health care is something that's very, very important to people. And the reason why we passed health care reform last year is because we saw time and time and time again that so many millions of Americans are uninsured and working people are uninsured. And people were losing their insurance, and the insurance companies were jacking up the prices, and it was going far higher than the rate of inflation. And the American people said enough. If we change our jobs, we want to keep our health care. If we lose our jobs, we want to keep our health care. If we have a pre-existing condition, we don't want to be denied coverage. If we have a child who's age 26, we want that child to be covered, which is what our bill does. And the Republicans would get rid of all of that. How many times have people been insured, and then suddenly the insurance company says, sorry, you've reached the lifetime cap or you've reached the annual cap, and we're not going to insure you anymore. This isn't a game. This isn't throwing red meat to a political crowd. This is something dealing with people's lives. And I think we ought to stop it. I think the majority has made their point time and time and time again. Now let's put our heads together and work for the American people in terms of fixing what we don't like in the health care bill. I yield back.
Chair, thanks, gentlemen. Anyone else seeking recognition? I think we're ready for the vote. The question now occurs on favorably reporting H.R. 1213 to the full committee. All those in favor say aye. Aye. Opposed, no.
No.
The ayes appear to have it. The ranking member requests a recorded vote. So the question of favorably reporting the bill to the full committee is postponed until this afternoon. The chair calls up H.R. 1216 and asks the clerk to report.
H.R. 1216.
Without objection, the first reading of the bill is dispensed with. So ordered. Are there any amendments or discussion on the bill? Chair recognizes gentleman Mr. Guthrie for 5 minutes.
Thank you, Mr. Chairman. I appreciate the opportunity to offer this bill today as this committee attempts to replace mandatory programs back into the discretionary appropriations, unlike they were in PPACA. I believe graduate medical education and teaching health centers are extremely important. Everyone agrees that a strong need for more primary care physicians in our healthcare system, but picking and choosing one program over another to receive automatic funding is unfair. Making these programs mandatory spending is unfair to all of the other healthcare programs that have to compete every year to continue to receive funds. For example, as Secretary Sebelius said during her testimony before this committee, the President's FY 2012 budget eliminates graduate medical education for children's hospitals. While children's hospitals must go through the regular appropriations process to fight for funding, the teaching health centers will receive an automatic appropriation. We're facing monumental budget constraints in Congress, and Congress is making difficult decisions about which programs to fund and which to reduce. I find it unfair that some programs are completely shielded and do not have to prove their merit to earn continued funding. I urge my colleagues to support this bill and yield back.
Chair thanks gentlemen. For what purpose does the gentleman seek recognition?
To strike the last word, Mr. Chairman.
The gentleman is recognized for 5 minutes.
Thank you, Mr. Chairman. The Affordable Care Act authorized and appropriated $230 million for a 5-year payment program to support accredited primary care residency training operated by community-based entities, including health centers. Now, this training takes place in community-based settings such as community health centers. Research shows that CHC-trained physicians, for example, are more than twice as likely as their non-community health center-trained counterparts to work in an underserved area. In my state of New Jersey, there was a January 2010 report that concluded that almost all counties have a number of primary care doctors below the national average of 88 primary care physicians per 100,000 residents. And this report warned that by 2020, the statewide deficit of doctors could reach 2,800. I don't really understand why my Republican colleagues want to take away this funding. They have repeatedly argued that there are not enough physicians now, let alone when the Affordable Care Act is fully operational. So it's clear that we need to provide care for those people in need of primary care services. And if we don't have this program, it's less likely that we're going to reach the goal of having enough doctors and primary care personnel to handle the additional people. And that's exactly why we have this program in the Affordable Care Act, because we know that with more people being covered, they'll be able to pay for a primary care doctor, but we have to make sure there are enough of them trained to be there by 2014. This distinction between mandatory and discretionary funding makes no sense in this context. Training medical residents has been a long accepted use of mandatory funding. Medicare graduate medical education, which we've talked about since I've been on the committee, since its inception in 1965, has been funded using Medicare trust fund dollars, and so the teaching health centers were provided funding in a manner similar to match the stability of Medicare GME. We're using mandatory funding. I can't think of any better use of mandatory funding than to provide funding for residents. They're not, I go back to the same thing again, and I think some on the other side even agreed. We can't be funding residency programs with 2-week CRs. It takes years. And that's why Medicare GME is mandatory, and that's why we need to ensure that the teaching health centers remain intact. So, again, I know that you want to repeal and defund the health care reform, but once again, this is again one of the least areas that makes sense in that context. And so I would ask a no vote, and I don't know if anybody else wants my time. If not, Mr. Engel, I'll yield to the gentleman from New York.
Thank you, Mr. Pallone. In the majority memorandum, the Republicans note that the President's budget eliminated the funding for for the Children's Hospital Graduate Medical Education. The memo goes on to state that the reason they're eliminating the mandatory funding for teaching health centers is so that, and I quote, Congress can evaluate the relative value of medical education programs and fund them accordingly, unquote. Many of us on both sides of the aisle today are concerned about the elimination of funding in the President's budget. I personally think it's a terrible idea. Children's hospitals provide critical training for pediatricians that we need, and I don't think we should eliminate funding for it. I think, contrary to the Republican logic, the fate of the Children's Hospital graduate medical education is exactly why we need to ensure mandatory funding for the teaching health centers. Residents are trained in years, not months or weeks. They deserve better certainty than a poor budget decision. The better comparison is to Medicare GME. Medicare provides funds for hospitals in order to train residents. We believe that program is properly mandatory. And so when we ask other institutions to train residents, they deserve the same certainty. The majority's memo states that the reason teaching health centers are converted into an appropriation is so that, quote, Congress can evaluate the relative value of medical education programs and fund them accordingly, unquote. Well, as I just said, Medicare graduate medical education is the biggest medical education program of them all. So my question for the sponsor is, when shall we expect forthcoming legislation to convert Medicare GME into a discretionary program? If you do it for one, why not do it for the other? I think it makes no sense to do it for either, and that's why I pose this. The American people shouldn't really have to watch this nonsense. This is about trying to take apart, as I said before, a program piece by piece, and this one in particular is an effort to make the dire predictions about workforce come true. I think we should reject this. I think it's a bad idea, and I think it goes in the absolute wrong direction. I yield back.
The chair will yield himself 5 minutes to respond. H.R. 1216 would convert the direct appropriations into an authorization of appropriations. The legislation allows for teaching health centers to receive funding through the normal appropriations process. By providing mandatory funds to teaching health centers, this section of PPACA disadvantages all other facilities and programs that train providers that must go through the normal appropriations process. And those include children's hospitals, training in family medicine, general internal medicine, general pediatrics, physician assistants, and programs to train nurses. Now, some have advocated the need to move away from hospital-based medical education. That may or may not be the correct policy. However, if we need to have a discussion on the most appropriate sites for medical education or changing the mix of where providers are trained, we should actually have that discussion, but we should not have a hodgepodge set of policies where some facilities get mandatory funding while others go through the normal appropriations process. Does anyone else seek recognition? The gentlelady seek recognition.
Mr. Chairman, to strike the last word.
The gentlelady is recognized for 5 minutes.
Again, despite promises from the new majority that this Congress would be focusing on creating jobs and bolstering the economy, the array of bills before us today have failed to deliver on this promise. In fact, not only do the majority's proposals today do nothing to create jobs or bolster the economy, a number of these bills actually exacerbate the problem by taking away new job opportunities, and this bill is one such example. With new investments in the health care law, we took tremendous strides towards expanding the primary care workforce. And we are already on the path to train 16,000 new primary care providers. So far in my home state of Wisconsin, we have received $3.8 million for a primary care residency program. And we know how important training primary care physicians and other providers is for our economy and for the rest of the healthcare system. Because if you think about it, these doctors and nurses serve as gatekeepers in the healthcare system, keeping people out of emergency rooms and helping us to grapple with spiraling healthcare costs by controlling them. This Republican bill that fundamentally alters the Teaching Centers Development Grants Program places this investment at risk and really could ultimately worsen the healthcare workforce shortage. And I fail to see how taking away funding for critical jobs will help bolster our economy or improve our healthcare system. And I would point again, it used to be that addressing workforce shortages in the primary care and public health system was a bipartisan issue. Our committee worked together on numerous proposals, some of which are incorporated in the Affordable Care Act. But this just seems to be yet another attempt to, if you fail at repealing the entire bill, then pick it apart piece by piece. I strongly urge my colleagues to vote against this measure, and I yield back the balance of my time.
Thanks. Gentlelady, does anyone else seek recognition? Gentlelady, for what purpose does gentlelady seek recognition? Gentlelady recognized for 5 minutes.
Thank you, Mr. Chairman. I'm speaking in opposition as well to H.R. 1216, a bill to defund critical medical education programs in the community, the Teaching Health Centers program. The Teaching Health Centers program allows community-based health centers to train future primary care doctors in their communities. Not only do these programs expand primary care services to know those who need them most, but they also train new providers with the experience and expertise needed to serve these populations. It's a unique concept and it's very worthwhile to be funded. But this misguided bill would defund the program, taking many qualified Americans out of the primary care workforce even before they're able to join it. Moreover, cutting these training programs also affects existing jobs. There are already 11 community-based entities from states across the country that have already committed to training primary care residents, and they've expanded their programs to do so. Taking away this funding is going to make it hard to justify the expansion from these clinics, forcing very tough choices and possible layoffs right at a time when our economy cannot withstand that. It will also deter other entities from participating in this program, since the funding will be very uncertain, making it more difficult to make business decisions to hire new instructors to do so. Yesterday in this subcommittee, members on the other side of the aisle warned of a shortage of medical professionals and that the Affordable Care Act would permit too many Americans access to primary care and that there wouldn't be enough service providers to go around. And then today, we are here looking at a bill that would cut a program that directly creates more medical professionals with just the expertise that's needed to fund expanding healthcare services for newly enrolled service recipients. It doesn't add up. The choice on H.R. 1216 is clear. If the claims of shortages in the medical profession we heard yesterday are false, then vote for this bill. But if you believe, like so many have pointed out yesterday, and that the public really understands that we do need more primary care professionals with the expertise to treat us, to treat our children, to treat our grandchildren, and the vast array of people in the communities now who at this point are not accessing health care services, then you have to vote against H.R. 1216 so that we can preserve and protect this important program. With national unemployment at 9%, I think we should all be able to agree that this job-cutting legislation is the wrong thing for Americans. It's the wrong cut at the wrong time. So I urge a no vote, and I'll yield my time to anyone, or I'll yield it back.
All right.
I'll yield back.
The gentlelady yields back. All time for debate, I think, is expired. The question now occurs on favorably reporting H.R. 1216 to the full committee. All those in favor say aye. Aye. Those opposed, no. The gentleman from the ranking member has requested a recorded vote, so the question on favorably reporting the bill to the full committee is postponed until this afternoon. The chair now calls up H.R. 1215 and asks the clerk to report.
H.R. 1215 to amend Title V of the
Without
Social
objection,
Security
the first reading of the bill is dispensed with. So ordered. Are there any amendments or discussion on the bill?
Mr. Chairman.
The chair recognizes gentleman Mr. Latta for 5 minutes.
I thank the chairman. I bring before the committee today H.R. 1215, which relates to Section 2953 of the Health Care Law. My legislation amends Title V of the Social Security Act to convert funding for personal responsibility programming from mandatory spending to an authorization of appropriations. This bill will also rescind any unobligated funds. I am extremely troubled by the fact that Obamacare put in place programs and spending that bypass Congress and gives full control to the administration. Section 2953 establishes state grants for personal responsibility education programs to educate adolescents about adulthood preparation. The programs in this section are duplicative of existing government programs, and each program must be reviewed to ensure that taxpayer dollars are best utilized and funds are not being duplicated. I'm very supportive of this bill that will convert the appropriation contained in this section of $75 million for each of the fiscal years 2010 through 2014 into an authorization. Congress needs to be the ones that determine funding through the programs and determine if they are duplicative and determine this through the normal appropriations process. Making this change could potentially save $375 million over 5 years. This is a large savings at a time when we must get our fiscal house in order. Supporters of the program contained in Section 2953 will have the ability to ensure that they are funded, just like any other federal programs are funded through the normal appropriations process. Again, as I said earlier, my constituents back home want Congress to get its fiscal house in order by reducing the debt and the deficit and eliminating unneeded spending. There are many more savings by fully repealing Obamacare, as we heard during the legislative hearing on this bill. CRS has found that Obamacare contains $105 billion in direct implementation spending that bypasses Congress's normal appropriations process. Converting Section 2953 of Obamacare into an authorization and subject to congressional oversight is a positive step in cutting unnecessary spending and in eliminating more bureaucratic control by the administration. I ask for your support of H.R. 1215. Thank you, Mr. Chairman. I yield back.
Chair, thanks, gentlemen. For what purpose does the gentleman seek recognition?
Strike the last word.
The gentleman recognized for 5 minutes.
Mr. Chairman, the U.S. has one of the highest teen pregnancy rates in the developed world. Each year, more than 750,000 women aged 15 to 19 become pregnant, with more than 80% of these pregnancies unintended. In addition, 1 in 4 young women ages 15 and 19 has a sexually transmitted disease, and young people account for over 1/3 of the estimated 56,000 new HIV infections each year. Our teens clearly need all the help we can reasonably and thoughtfully and accurately provide to address this problem. The program PrEP, which is what the gentleman is seeking to defund, is the only state grant program of its kind designed to address the interrelated prevention and health needs of adolescents. Under the Affordable Care Act, the program receives $75 million for each of 5 fiscal years, 2010 through 14. Of this amount, $55 million is dedicated to state grants, and states have complete discretion whether or not to apply for PrEP funding. It's not mandatory. The response has been overwhelmingly positive. 43 states and D.C. have applied for PrEP support. Programs supported by PrEP are required to provide information on both abstinence and contraception for the prevention of unintended pregnancy and sexually transmitted infections, including HIV. They must be evidence-based. Programs must also address at least 3 adulthood preparation topics: comprehensive approaches to sex education, those that are medically accurate, age-appropriate, and that include information about both abstinence and contraception, have been found to be effective in delaying the onset of sexual intercourse, reducing the number of sexual partners, and increasing contraception and condom use among teens. And this stands in stark contrast, I may add, to abstinence only until marriage programs. It makes absolutely no sense, in my opinion, to take away funding for this program. This is especially true in light of the fact that our Republican colleagues stand ready to support continued mandatory funding for a related program which studies indicate does not work, and that's the abstinence-only under marriage program, also found under Title V of the Social Security Act. So put aside for the moment that one program actually has a proven track record and the other does not, but let's just examine the hypocrisy. What's the justification for providing mandatory funding spending for one program and not the other? And the answer is simple. That is that the Republicans like the abstinence-only program, and they don't like PrEP. It's clear. I mean, for a party that claims to be the defenders of states' rights, my Republican colleagues should remember that 43 states, including Ohio and Pennsylvania, applied for PrEP, while only 30 applied for abstinence only. So clearly the governors see a strong value in PrEP, and for that reason I would urge my colleagues to oppose this legislation.
Chair, thanks, gentlemen. Chair recognizes himself for 5 minutes to respond. The proposed legislation converts the mandatory spending program created under PPACA into an authorization. Many of the subjects taught in these programs are duplicative of other prevention programs offered throughout the federal government to reduce high-risk teenage behavior and increase protective factors. Programs to prevent overeating, reckless driving, gang membership, unemployment, and criminal activities are funded in the Department of Health and Human Services, in Education, Labor, Transportation, and Justice. The Department of Education has programs for career development and financial literacy that will also be funded through this program. The proposed legislation would convert this new grant program into an authorization. Supporters of the program would have the ability to ensure that it is funded, but will have to demonstrate that it is not duplicative of other federal programs. Does anyone seek recognition? Gentlelady from California, for what purpose does the gentlelady seek recognition?
I move to strike the last word.
Gentlelady is recognized for 5 minutes.
I speak in opposition to H.R. 1215, which is a bill to defund important education programs to keep our youth healthy, both while they are teenagers and long into their adulthood. The Personal Responsibility Education Program, or PrEP program, provides important funding to ensure that youth receive evidence-based, effective education to protect themselves from unplanned pregnancies, from unhealthy relationships, and sexually transmitted diseases like HIV. These programs truly embody that an ounce, I know this has been used already in this hearing, but this is so clearly true here, an ounce of prevention is certainly a pound of cure, both for the individual and really for our nation as a whole. Preventing teen pregnancy or postponing teen pregnancy keeps our Medicaid costs low, keeps our children in school so that they can learn. It sets them up for better job opportunities in the future. And preventing the spread of sexually transmitted diseases and HIV keeps individuals healthy and in the workforce. It can prevent against cancer and infertility, and it can keep our young people off expensive medication regimens. Just as we use math skills every day long after we graduate, the skills taught in these programs, the PrEP programs, can protect and enhance the well-being of youth long into their futures. But this bill to eliminate funding for this program is not only misguided public policy, it also highlights the hypocrisy of those on the other side of the aisle who claim mandatory funding is in some respects invalid, is invalid in some respects. And yet a program that would fund abstinence only until marriage programs which have been discredited as ineffective, inaccurate, and discriminatory, and in some cases even harmful. This program remains untouched, a mandated program. And just like we have witnessed in this and other subcommittees, science and evidence come second when compared with dogma and politics. In this way, the double standard of those who wish to take away funding from the PrEP program and yet let it remain in a mandated program for abstinence, this is really clear, this double standard. The money is there. Nearly every state in the union has applied for it, and already they have received grants, many states, to bring this critical education to their young people. The states know how important and cost-saving this kind of funding is. So I urge a no vote on this bill so that we can continue to have the opportunity to take care of our youth and set them back on a path on a path for a healthier life. And, Mr. Chairman, I'm asking unanimous consent to enter into the record a letter from the Sex Education Coalition in opposition to this misguided bill. I believe the letter may be on file already. This is just a
without objection.
Thank you, Mr. Chairman.
We entered into the record.
And I'm prepared to yield back.
Chair thanks the gentlelady. Does anyone else seek recognition? Gentleman from Georgia, Dr. Gingrey, for 5 minutes.
Mr. Chairman, thank you. And I intend to yield some of my time to the author of the bill, Mr. Latta. You know, we're discussing in all 5 of these bills today. You know, it's an issue of fiscal responsibility and converting mandatory directed spending to discretionary. And I, for the life of me, can understand why any member of Congress wouldn't want to continue to have that kind of oversight to look at programs and particularly this program, this personal responsibility education program, when there's so many programs so similar, if not identical. The chairman just spoke of a number of programs. The Title 20 funds and the Office of Adolescent Pregnancy Programs has a lot of funding in regard to this. And so our issue is not with the worthiness of education and educating our youth and helping them understand what risky behavior is all about and the tragic consequences of risky behavior. We understand that. We get it. But it's simply to say, once again, in this bill, that we think that there should not be just an automatic pilot on these spending programs, and you have really, you lose control of it. I know $375 million worth of spending in a $1 trillion bill seems like a spit in the ocean, but you know, first thing you know, as it's been said before, it amounts to real dollars. So that's what the concern here on our side of the aisle, this member, and I think all of my colleagues over on this side are questioning and why we want to change this. It is not that we're opposed to the education aspect. We think that's very important. With that, Mr. Chairman, I want to yield what remaining time I have to my colleague from Ohio, Mr. Latta.
Well, thank you very much. I appreciate the gentleman for yielding. And just to go over just a few of these and to show you where we are in dollars. This is for the fiscal 2012 request. And we're looking for the Centers for Disease Control and Prevention. I'm just going to round these off if I may. $22 million, teen pregnancy prevention. HIV school health, $40 million. Department of Ed, Promised Neighborhoods, $150 million. Substance Abuse and Mental Health Services Administration, Minority AIDS Initiative, $41 million. Health Service Resources Services Administration, Maternal and Child Health Block Grant, again, fiscal year 2012 request, $655 million. This is for family planning for teens to prevent pregnancy and sexually transmitted diseases. Title 10, $327 million, information and screening on pregnancy, sexually transmitted diseases, HIV and AIDS. This program serves teens and young adults under the age of 20. Office of Assistant Secretary for Health Administration for Children and Families. We're looking at Office of Minority Health, another about $58 million, and promoting safe and stable families, $443 million. I appreciate the gentleman for yielding.
Chairman, thanks, gentlemen. Anyone else seeking recognition? For what purpose does the gentlelady seek recognition?
Mr. Chairman, to strike the requisite number of words.
The gentlelady is recognized for 5 minutes.
Thank you, Mr. Chairman. And before I begin, I would like to ask unanimous consent to submit for the record a letter of support for the Personal Responsibility Education Program led by Advocates for Youth and signed by 115 national, state, and local organizations, including the AIDS Foundation of Chicago and the Illinois Caucus for Adolescent Health. I'm doing this at the request of Congresswoman Schakowsky, and I believe she has submitted these documents to the majority for pre-screening.
Without objection, it will be entered into the record.
Thank you, Mr. Chairman. Each of the bills that we've been reviewing today and marking up represent the Republican attempt to either repeal the new health care law piece by piece or dismantle the programs that have already gone into effect or eliminating reliable funding for critical programs that will reduce overall health spending while improving the health and lives of millions of Americans. These bills before us today will not create jobs or foster economic growth. The Personal Responsibility Education Program, or PrEP, is focused on preventing unintended teen pregnancy and reducing cases of sexually transmitted disease, including HIV and AIDS. Funding through PrEP has already been distributed to states through grants to programs that target at-risk youth ages 10 to 19, particularly youth who are homeless or in foster care or live in areas with high teen birth rates or are living currently with HIV and AIDS. The programs which receive grant funding are required to place a substantial emphasis on both abstinence and contraceptive use. Importantly, these programs must be evidence-based. Wisconsin, my home state, will receive $4.7 million over the next 5 years through PrEP, assuming that we defeat this bill. Upon receipt of this grant funding, our former Secretary of Health Services in Wisconsin, Karen Timberlake, praised another critical benefit of PrEP funding. The program will lead to cost savings in other areas of our health system. Secretary Karen Timberlake said, for each child who makes healthier choices for themselves, we also realize cost savings in Wisconsin's Medicaid program and many other programs as well. Mr. Chairman, I fail to see how endangering funding for this really critical program that will lead to an overall reduction in health care spending is considered fiscally responsible. Furthermore, I fail to see how endangering funding for a program that will improve the lives and health of our young people is socially or morally responsible. And I also just want to note that viewed in the greater context of Republican efforts to zero out and attack family planning services in America, I feel that this is yet another attack on American women, in this case young women and girls. I urge my colleagues to vote against this irresponsible measure, and I yield back the balance of my time.
Chair, thanks, gentlelady. Anyone else seeking recognition? For the purpose of the gentleman seek recognition.
Yes, Mr. Chairman, I move to strike the last word.
The gentleman is recognized for 5 minutes.
Thank you, Mr. Chairman. Let me just say that if my friends on the other side of the aisle believe that these programs should be authorized rather than mandatory, then why wouldn't you convert abstinence-only programs from mandatory to discretionary? I mean, it's the same logic. ACA appropriates $75 million per year through FY14 for personal responsibility education grants, or PrEP. PrEP grants go to states for programs to educate adolescents on abstinence and contraception for prevention of teenage pregnancy and sexually transmitted infections, including HIV, AIDS, in high-risk, vulnerable, and culturally underrepresented populations. Funding is also available for evidence-based innovative teen pregnancy prevention strategies. Funding is also used for research and evaluation training and technical assistance. On September 30th last year, 2010, HHS announced PrEP grant awards totaling $55 million. Of this amount, $45 million was awarded as formula grants to the 46 states, including Washington, D.C., and the remaining $10 million was awarded competitively to a broad range of grantees to test innovative approaches to reducing teen pregnancy and repeat pregnancy among those under the age of 21. I mean, I strongly believe we should be empowering Americans to take a hold of their health care and help educate them on safe health practices. I also want to make the point that states have the option to apply or not apply for PrEP funds, and we should support this right. As I mentioned, 43 states plus D.C. applied for PrEP funding, and these are governors who applied for these funding who are both Democrats and Republicans. And in contrast, only 30 states applied for abstinence-only funding. So 43 states applied for this PrEP funding, whereas only 30 states applied for abstinence-only funding. Yet, we want to make the program that 43 states applied for, we want to make those authorized rather than mandatory, but when it comes to abstinence-only, we go in the opposite direction. So let's be consistent here. We should support states that want to apply for evidence-based grant programs. We should really do that. And I would ask my friend, why didn't he introduce a bill to convert abstinence only, which is Section 513 of Social Security, the Social Security Act, to an authorization? I mean, why do this and not do the other? I just don't get it. So I think this is a bad idea. I oppose this bill. And again, as I mentioned before, this is simply, once again, trying to dismantle the health care bill piece by piece by piece by piece. It's ill-advised and it should be defeated, particularly, as I pointed out, when we have such an inconsistency. You know, you can't be inconsistent. I mean, you can be inconsistent, but it's not very compelling. A program you like, you want to make mandatory. A program you don't like, you want to make it authorized rather than mandatory. If you want to change it, change everything, and then maybe we could understand where you're coming from. But right now, with this picking and choosing, if you don't like what we did, then what you're doing is not any better. I yield back, and I oppose the bill.
Chair, thanks, gentlemen. The question now occurs on favorably reporting H.R. 1215 to the full committee. All those in favor say aye. Aye. Those opposed, no.
No.
The ranking member requests a recorded vote, so the question of favorably reporting the bill to the full committee is postponed
Mr. Chairman.
until this afternoon. For what purposes, gentlemen?
I just wanted to ask Mr. Chairman unanimous consent to enter the following letters in opposition to H.R. 1215, which I believe you have. One is a group sign-on letter from local, state, and national organizations, including the American Public Health Association. And the second is HIV Health is from HIV Healthcare Access Working Group.
Without objection, so ordered. As indicated, the subcommittee will now stand in recess until 2:30. If there are floor votes being conducted at that time, we will convene immediately after the last vote. At that time, the only business we will conduct is the 5 roll call votes that have been requested, ordered. The subcommittee will now stand in recess. Subcommittee will come to order. When the subcommittee recessed, it had completed action on 5 pieces of legislation under the new health care law. We will now conduct the roll call votes on reporting those bills favorably to the committee. As a reminder, the bills were, first, H.R. 1217, a bill to repeal the Prevention and Public Health Fund. Secondly, H.R. 1214, a bill to repeal mandatory funding for school-based health center construction. Thirdly, H.R. 1213, a bill to repeal mandatory funding provided to states in the Patient Protection Affordable Care Act to establish American Health Benefit Exchanges. Fourthly, H.R. 1216, a bill to amend the Public Health Service Act to convert funding for graduate medical education in qualified teaching health centers from direct appropriations to an authorization of appropriations. And finally, H.R. 1215, a bill to amend Title V of the Social Security Act to convert funding for personal responsibility education programs from direct appropriations to an authorization of appropriations. The clerk will call the roll on H.R. 1217.
Mr. Burgess, Mr. Whitfield, Mr. Shimkus, Mr. Shimkus, aye. Mr. Rogers, Mr. Rogers, aye. Mrs. Myrick, Mr. Murphy, Mr. Murphy, aye. Mrs. Blackburn, Mrs. Blackburn, aye. Mr. Gingrey. Mr. Gingrey, aye. Mr. Latta. Mr. Latta, aye. Mrs. McMorris-Rogers. Mrs. McMorris-Rogers, aye. Mr. Lance. Mr. Lance, aye. Mr. Cassidy. Mr. Cassidy, aye. Mr. Guthrie. Mr. Guthrie, aye. Mr. Barton. Mr. Upton. Mr. Upton, aye. Mr. Pallone. Mr. Pallone, no. Mr. Dingle. Mr. Dingle, no. Mr. Towns. Mr. Towns, no. Mr. Engel. Mr. Engel, no. Mrs. Capps. Mrs. Capps, no. Ms. Schakowsky. Ms. Schakowsky, no. Mr. Gonzalez. Mr. Gonzalez, no. Ms. Baldwin. Ms. Baldwin, no. Mr. Ross. Mr. Ross, no. Mr. Weiner. Mr. Weiner, no. Mr. Waxman. Mr. Waxman, no. Mr. Pitts. Mr. Pitts, aye. Mr. Burgess, aye. Mrs. Myrick? Mrs. Myrick, aye.
The clerk will report the result.
Mr. Chairman, on that there were 14 ayes and 11 nays.
The ayes have it, and the bill is favorably reported. Clerk will call the roll on H.R. 1214.
Mr. Burgess. Mr. Burgess, aye. Mr. Whitfield. Mr. Shimkus. Mr. Shimkus, aye. Mr. Rogers. Mr. Rogers, aye. Mrs. Myrick. Mr. Murphy. Mr. Murphy, aye. Mrs. Blackburn. Mrs. Blackburn, aye. Mr. Gingrey. Mr. Gingrey, aye. Mr. Latta. Mr. Latta, aye. Mrs. McMorris-Rogers. Mrs. McMorris-Rogers, aye. Mr. Lance. Mr. Lance, aye. Mr. Cassidy. Mr. Cassidy, aye. Mr. Guthrie. Mr. Guthrie, aye. Mr. Barton. Mr. Upton. Mr. Upton, aye. Mr. Pallone.
No.
Mr. Pallone, no. Mr. Dingle. No. Mr. Dingle, no. Mr. Towns. No. Mr. Towns, no. Mr. Engel. No. Mr. Engel, no. Mrs. Capps. No. Mrs. Capps, no. Ms. Schakowsky. No. Ms. Schakowsky, no. Mr. Gonzalez. No. Mr. Gonzalez, no. Ms. Baldwin. Ms. Baldwin, no. Mr. Ross. No. Mr. Ross, no. Mr. Weiner. No. Mr. Weiner, no. Mr. Waxman. Mr. Waxman, no. Mr. Pitts.
Aye.
Mr. Pitts, aye.
Are there other members wishing to be recorded?
Mrs. Myrick? Mrs. Myrick, aye.
The clerk will report the result.
Mr. Chairman, on that there were 14 ayes and 11 nays.
The ayes have it, and the bill is favorably reported. The clerk will call the roll on H.R. 1213.
Mr. Burgess. Mr. Burgess, aye. Mr. Whitfield. Mr. Shimkus. Yes. Mr. Shimkus, aye. Mr. Rogers. Yes. Mr. Rogers, aye. Mrs. Myrick. Mrs. Myrick, aye. Mr. Murphy. Mr. Murphy, aye. Mrs. Blackburn. Mrs. Blackburn, aye. Mr. Gingrey. Mr. Gingrey, aye. Mr. Latta. Mr. Latta, aye. Mrs. McMorris-Rogers. Mrs. McMorris-Rogers, aye. Mr. Lance. Mr. Lance, aye. Mr. Cassidy. Mr. Cassidy, aye. Mr. Guthrie. Mr. Guthrie, aye. Mr. Barton. Mr. Upton. Mr. Upton, aye. Mr. Pallone.
No.
Mr. Pallone, no. Mr. Dingle. No. Mr. Dingle, no. Mr. Towns. No. Mr. Towns, no. Mr. Engel. No. Mr. Engel, no. Mrs. Capps. No. Mrs. Capps, no. Ms. Schakowsky. Ms. Schakowsky, no. Mr. Gonzalez. No. Mr. Gonzalez, no. Ms. Baldwin. Ms. Baldwin, no. Mr. Ross. Mr. Ross, no. Mr. Weiner. Mr. Weiner, no. Mr. Waxman. Mr. Waxman, no. Mr. Pitts.
Aye.
Mr. Pitts, aye.
Are there other members wishing to be recorded? If not, the clerk will report the result.
Mr. Chairman, on that there were 14 ayes, 11 nays.
The ayes have it. The bill is favorably reported. The clerk will call a roll on H.R. 1216.
Mr. Burgess. Aye. Mr. Burgess, aye. Mr. Whitfield. Mr. Shimkus. Mr. Shimkus, aye. Mr. Rogers. Aye. Mr. Rogers, aye. Mrs. Myrick. Mrs. Myrick, aye. Mr. Murphy. Mr. Murphy, aye. Mrs. Blackburn. Mrs. Blackburn, aye. Mr. Gingrey. Mr. Gingrey, aye. Mr. Latta. Mr. Latta, aye. Mrs. McMorris-Rogers. Mrs. McMorris-Rogers, aye. Mr. Lance. Mr. Lance, aye. Mr. Cassidy. Mr. Cassidy, aye. Mr. Guthrie. Mr. Guthrie, aye. Mr. Barton. Mr. Upton. Aye. Mr. Upton, aye. Mr. Pallone.
No.
Mr. Pallone, nay. Mr. Dingle. No. Mr. Dingle, nay. Mr. Towns. No. Mr. Towns, nay. Mr. Engel. No. Mr. Engel, nay. Mrs. Capps. Mrs. Capps, nay. Ms. Schakowsky. Ms. Schakowsky, nay. Mr. Gonzalez. No. Mr. Gonzalez, nay. Ms. Baldwin. Ms. Baldwin, nay. Mr. Ross. No. Mr. Ross, nay. Mr. Weiner. No. Mr. Weiner, nay. Mr. Waxman. No. Mr. Waxman, nay. Mr. Pitts.
Aye.
Mr. Pitts, aye.
Are there others wishing to be recorded? If not, the clerk will report the result.
Mr. Chairman, on that there were 14 ayes and 11 nays.
The ayes have it, and the bill is favorably reported. The clerk will call the roll on H.R. 1215.
Mr. Burgess. Mr. Burgess, aye. Mr. Whitfield. Mr. Shimkus. Mr. Shimkus, aye. Mr. Rogers. Mr. Rogers, aye. Mrs. Myrick. Mrs. Myrick, aye. Mr. Murphy. Mr. Murphy, aye. Mrs. Blackburn. Mrs. Blackburn, aye. Mr. Gingrey. Mr. Gingrey, aye. Mr. Latta. Mr. Latta, aye. Mrs. McMorris-Rogers. Mrs. McMorris-Rogers, aye. Mr. Lance. Mr. Lance, aye. Mr. Cassidy. Mr. Cassidy, aye. Mr. Guthrie. Mr. Guthrie, aye. Mr. Barton. Mr. Upton. Aye. Mr. Upton, aye. Mr. Pallone.
No.
Mr. Pallone, nay. Mr. Dingle. Mr. Dingle, nay. Mr. Towns. No. Mr. Towns, nay. Mr. Engel. No. Mr. Engel, nay. Mrs. Capps. Mrs. Capps, nay. Ms. Schakowsky. Ms. Schakowsky, nay. Mr. Gonzalez. No. Mr. Gonzalez, nay. Ms. Baldwin. Ms. Baldwin, nay. Mr. Ross. Mr. Ross, nay. Mr. Weiner. Mr. Weiner, nay. Mr. Waxman. No. Mr. Waxman, nay. Mr. Pitts.
Aye.
Mr. Pitts, aye.
Are there other members wishing to be recorded? Mr. Whitfield.
Mr. Whitfield, aye.
The clerk will report the result.
Mr. Chairman, on that there were 15 ayes, 11 nays.
The ayes have it, and the bill is favorably reported. Without objection, the staff is authorized to make technical and conforming changes to the bills approved by the subcommittee today. Hearing no objection, so ordered. The chair thanks all members and staff. The subcommittee stands adjourned.